without end. Amen. The Lord be with you.
And with your spirit.
May Almighty God bless you, the Father, and the Son, and the Holy Spirit.
Amen.
Let us bless the Lord.
Thanks be to God. Thank you, Your Lordship, for the blessing. Once again, I want to take this chance to welcome all of us to Wednesday, day 3 of our conference. We want to start by taking a number of things that we should have done yesterday and which were not done, but by design, and which are equally important. I want to start by asking that if we have any housekeeping issues. I'm alerted that a number of us have a bit of housekeeping issues, especially where we are staying. Kindly either see myself or Pauline. We'll see how to liaise with our host here so that your stay is as comfortable as possible. Kindly, if you have any housekeeping issues within your quarters where you are staying, talk to myself or Pauline, who will be taking care of our welfare issues. The other thing that I want to make a request is that we want to ask someone to help us keep track of time. And I want to appreciate that yesterday we started off a bit late, but luckily by the grace of God we were able to catch up. But nevertheless, it's important to get a timekeeper who will help us to manage our times today, so that if George, as a facilitator who speaks too much, continues speaking, he's alerted that his time is up. So either we can nominate or we can ask someone to volunteer themselves. Either options are okay. I'll start with a volunteer. Anybody to volunteer to keep time for us, to help us keep time? Anybody going one? Going to? Thank you, sister. All the way from Ethiopia. Let's clap for sister. Sister, thank you so much for accepting to help us keep track of time. We will agree how that will be done, but yes, thank you, sister. The other thing that we want to request is someone to keep us energized. We want to ask someone to keep us energized. And hey, why are you quick to suggest? I have not even declared the mode of elections we are using. Okay, due to public demand for the Kevo, you have no choice. You just have to accept. Father Kevo, where are you? Where is Father Kevo? You know, Father Kevo is the only person who will, before he starts to speak, people are laughing. Father, why are you looking at me like that now? Thank you. I think that is done. Father Kevo will help us to keep the energies going. If you want to make an interlude, feel free. If you want to interact, facilitate us to help them deliver better, feel free. We will not guide on how you go about it. Having said and done that, I think I want to take this chance to introduce to us our moderator for the day. But before I do, yesterday we took our morning session was filled with a lot of addresses from different speakers, and it was climaxed by the keynote address by His Grace. And throughout the reflections that were given or shared within that particular session, a number of things prominently kept coming into our mind, so we kept being reminded about them. One is the centrality of the child in the ministry of Jesus Christ. That's a thought that kept coming through and through. The second thing that kept coming is the commitment of the church to childcare and caring for the vulnerable. I think that was mentioned over and over again. And I think for me the most important thing that again kept repeating itself is the centrality of the family in respect to childcare and upbringing and nurturing of children. And those three thoughts, in a way, formed the basis of our reflections for the rest of the day. We kept talking about the role of the family. We kept talking about the commitment of the church. We kept talking about where every child should be. And this is within a safe, loving, and caring family. Of course, the rest of the day, we had a number of presentations that were done. And the day ended with the launch of the learning products. If you recall the very colorful evening that Pauline helped us to do, we had a beautiful launch of many products. I don't know whether you have taken time to flip through those products. The teacher in me gets tempted to ask us to show by a show of hand how many flip through. But the teacher has not fallen into the temptation, so I will not ask. But just take time, look at the posters, look at those poster messages. They are inspiring, they are thought-provoking messages from different speakers who've spoken to us in the past about this topic. Look at the brochures. The brochures have a set of information, factual information. It will be helpful. It can be helpful to correct our thinking, to shape our minds, to respond to some questions that we have. But also some of those brochures will actually help us to be able to reflect on what has been achieved within this initiative. Please take time. If you look at the magazine, it's a compilation. The better part of the magazine is actually a documentation of the KCCB work. Please take time to look through. And if you have any questions about anything documented in that magazine, talk to Elizabeth, talk to Father Jacob, talk to Sister Lucy, talk to Sister Wayua, talk to Sister Monica. All these people here, they are the owners of the information in that magazine. Please talk to them. If you have any question about a particular aspect within what was documented, talk to the people who are behind that information. Of course, if you ask me, I will direct you to who specifically was quoted in those writings. Because Amecea did not author anything, we just put it together on behalf of KCCB and the implementing CCIs. Today, we shift a little bit from the products, but we'll keep interacting with the products at different intervals. But we want to start our morning with a reflection on a bit of data. We want to look at what is the state of, what are statistics like? What are numbers telling us? They say that numbers don't lie. What are numbers telling us about the state of children in institutional care within the church at the regional level? Then we look at the country context, and then we look at an important element of disability inclusion, not specific to a CCI setting, but generally within the life of the church. And particularly, we'll share two very critical elements. Sister Monica will be helping us to think through caring for children with disabilities in a CCI setting. Father Amogast will share his experience and bring us to reflect about involvement of persons with the disabilities in our liturgy and in the life of the church. And towards the afternoon, if you look at your programs, we will propose a shift so that the last session for today, we want to propose we move it tomorrow. Reason why? Because we want to create a bit more time for the panel that will be happening later in the day with the caregivers, and create a moment for us to talk a little bit more about those experiences, to be able to interrogate the sharings that will have happened throughout the day, and therefore give us an opportunity to speak and reflect on the sharings that will have happened We noted that yesterday we rushed a little bit too much. There are too many presentations that were packed, and we did not have sufficient time to engage us in discussions, including responding to questions. Father Silvanus Reed tried to give us time to respond to the questions, but unfortunately, the timekeeper kept saying we have to stop. So to mitigate that, we have proposed that we shift the last session from today. We'll carry it over to tomorrow, but we want to reassure all of us that we will be able to manage that time properly so that tomorrow's activities do not get affected by that shift in the program. Do you allow us to do that? Thank you. Without any further ado, allow me to introduce to us Reverend Father Paul Igueta. Reverend Father Paul works for Amecea Secretariat. Yesterday he reminded me that I should have written something on the program that I did not write. Father, can I tell them what you told me? He works for Amecea Secretariat as the coordinator for the Department for Promotion of Integral Human Development, and therefore, as he comes to us, do not be surprised that he'll speak a lot of justice issues. Do not be surprised that he'll ask us to be very peaceful, because that is the core of his work at Amecea Secretariat. Let's put our hands together and welcome our moderator for the morning session, Reverend Dr. Father Paul Igueta.
Thank you, George. God is good. I can see some of us very far. When you all find the seats around us so that at least not struggle. Our facility has a lot. The last seat, we can come around here. You are doing some special work here. God is good. So I am who I am. Who John just introduced me to you. We are colleagues. We work for Amecea. My part will be very short, having hand of what I do, and majorly I do on implementation of Laudato Si.
Sorry, Father, for interrupting you. I totally forgot that we had asked us to write down some questions from yesterday's sessions. Kindly let me see if anybody has such questions. We did not get any question by yesterday. Anybody wrote any question that we would need to respond to? Anybody has a written question? Kindly pass them to me. I'll go around picking them. Then we'll designate different people to respond based on the nature of the questions. Thank you.
Sawa, George. So now, my responsibility is to introduce our day's facilitators, but I would hand them. I know the first facilitator, we've eaten some of our time, but because I know her, she knows how to summarize. She will still summarize within that very time, so that at least we are able to move according to the program. And now I wish to introduce unto all of us, our dear sister will be presenting collaboration and consolidation of learning for impact data set for the CC Regional Portrait, Sister Devin Mukwana. Let us applaud the sister as she comes to present to us. Moja mbili tatu. No, those of you who are living during Moi time, you know there was a way we were clapping. 1, 2, 3, clap. Karibu, sister. Asante sana.
Thank you. Wow, that was Moi's time. I don't know if all of us know Moi. He was one of our presidents, anyway, former presidents, late. Your Lordships, present, SGs from our different conferences, SGs from our national associations of religious men and women in our region, present, Reverend Fathers, sisters, brothers, our lay faithful present, government officials, good morning. God is good. Yes. Thank you. I'm privileged and humbled to be here to share with you. It's Eastern, not East. It's Eastern because we are sharing the implementation of care reforms by sisters in 4 countries in our region, in the Amecea region. That is Kenya, Uganda, Zambia, and Malawi. And allow me, before I begin, I request the following to stand up and to see the people who are implementing or who are behind all these good works. So, Sister Lydia, please. She's the SG of Aru. We have SG from Malawi, Orim. We have Sister Euphrasia Masiga, Coordinator, Aru. We've got Sister Sister Catherine from Zambia. In absentia, we have Sister from Malawi, who's not with us here, myself, and in absentia, Sister Basilisa, and the rest who have not joined us. So, as you've read up there, it's Catholic Care for Children in Eastern Africa. And yesterday, as we heard from the presenters, care reform is not new to us. And we are talking of care reforms in the church, and it's not the first time the church is caring. And we have to be all assured of that. The church has been caring since time immemorial. And therefore, when we talk of reforms, it's only that maybe we are trying to add something or to change something. So that's what we've been doing since 2016. And as we look at their presentation there, we see that care reform began in Uganda with the sisters in 2016. Then Zambia followed. Then we have Kenya 2018. We've got 2020, the International Union of Superior Generals. The same time where we had Malawi and Sri Lanka, which is not here because it's not in our region, but we've got Sri Lanka. So seeing that care reform really is moving, and sisters are also part of the champions and leading the way. So you can also clap for us, please. So those sisters you see there, some of them we've just seen here around. I remember this is a time when we were trying to lobby Amecea, and the question was, why is it that children are always told sisters' children? And why is it that it's only sisters who are running up and down with the children issues? And we are asking our Reverend Fathers during the meeting that was in Tanzania, if I'm not wrong. And we put that question to them and asked them, is care reform only the work of sisters? And they said no. And we asked them, do you think that this is a pastoral issue? And they said, wait a minute, you are right. And that's why Amecea here present, we are lucky and happy that now we are learning and are leading. So a clap for Amecea, please. So whatever I'm going to share here, these are materials from our rapid assessments compiled from our different countries. Of course, some evaluation studies, baselines, and all that. So these are the works of sisters in these different countries that have been taking place since 2016 to present. And of course, this data is as per 2023. Of course, a lot has changed. We might find that we've got additional or maybe subtraction, depending on the dynamics that do exist. So, when we talk of care reform, of course, we are looking at both disability focus, because we are talking of inclusion. And earlier on, we used just to talk of children in the institutions, reintegrating children back to the community, the families and all that, or communities. But none of us used to talk about disability. But we realized that a big number of a chunk of institutions that we do have care for the children living with disability. And something which was disturbing was that most of these children are the children who are left behind. Some are left to die in the institutions because they say they don't have families. I don't know, do we have people who are just born without a family? I don't know. But that's what's purported to be, and which is not true. It's just a fallacy. But then we see that in all these countries, as we are seeing, we've got institutions that purely take care of children living with disability or who are enabled differently. Then we've got children who are in their normal status, and then we've got residential and non-residential. So looking at this, we see that in total, in like Kenya, we've got these children living with disability who are at 27%, then Malawi 28, Uganda 47, then Zambia 61. So that shows you that there is a lot of work needed. And when we talk of disability, it's with us. So in the work of sisters, we don't have only CCIs, pure CCIs, because when you talk of CCI, these are residential institutions where our children reside, live, go to school and come back. But something good which we have to celebrate is that we also do have sisters who have programs that support children purely from the community. They don't really bring children to the institutions, but they reach out to the families, they reach out to the children. What we are promoting here, because we want to see that children are supported from their families, within their families, not in the institutions. So already there's good work that's happening. And for instance, sister here, she supports children who are affected or infected with HIV, plus their parents and their relatives. So she goes to the community, supports them economically, socially, they support the families so that they're able to take care of their children. So whatever we've been discussing, as our government official yesterday said, that why is it that 8 children out of 10 have parents? Meaning that still we can support the parents because there's a problem in the family. Then we need to respond to that. So it's good also to understand why we are talking of institution of care and who owns and why they are key, or why is it important for us to know who owns, because these are the people who will enable change, because they're the people whom we have to approach first so that they move the change. And with this, in this context, in the 4 countries, as we look up there, we see that women religious, they own 53% of the childcare institutions. We shall come to why. Then we see men religious at 8%, dioceses at 36%, and then others at 3%. And of course, as we move on, we also want to understand who manages them. And something funny is that, again, women religious, and of course not also leaving out men religious, few of them also, they manage 76%. So you find that maybe my Lordship Bishop Mongela might decide to have a CCI and will request a congregation of sisters to come and take care of the children. So that's why you find that many sisters are in the management and at the same time own these institutions. And that's why we ask, why is it that women religious are in this mission. And of course, the answer is just simple. Many of our congregations are animated by charism of care. Majority of them have a care for the vulnerable, and in most cases children. And that's why you find many of them own and many of them again manage. Or some, they manage because they are being requested to by either the diocese or some congregation, male congregations and the rest. So this is more or less the same with what just sharing. So what do we see there? Imagine those are beds of our young ones, our angels. Imagine in the 4 countries in the region, how many of those ones? Thousands, so to speak. And imagine there are only 4 countries. So this one is just like an estimation from the data we have, 10,000 children in the 4 countries that are being taken care by the church. So our government officials, wherever we are, how can we come up with policies minus the church? That should be the question. Because we are the primary caregivers. So therefore, anything when it comes to care of children or vulnerable adults, please, let's give the church an upper hand into policy making, and the rest of the things will move, because we understand and we are the people with these children. So we know their plight. So looking at these statistics, we see really big numbers. But our prayer is we are sharing this to see that we challenge ourselves to see that these numbers reduce. But something beautiful here is that when we are looking at the residential and the community-based, we are seeing a big number also kind of programs. Children are out there, they are not in the institution. So it shows that it's possible for us to take care of children in the families. Look at Kenya there. Residential is 4,000, then community is 5,000. That shows that we can reverse the whole thing. The same when you go to Malawi, same in Uganda, same in Zambia. So it's us today to think, what should we be doing to ensure that these numbers are reversed? That when we meet next time, when Amecea invites us, we shall be talking of maybe 10% of this, or 10 or 100 children, but not in thousands. Good news is that from 2016 to present, of course, this is per 2023, 3650 children, that's 3,650, and of course, when I do my mathematics, just little bit, when I add to the Kenya now, the number of children that we have reintegrated as per today, it should be 4,017. That is minus Uganda, Zambia, and Malawi. If they give their statistics as per now, those numbers are up. So it shows that the church already, we are doing something and we're in the right trajectory. So clap for ourselves. This is not a joke. Imagine 3,000 children alive, even if it's just one, it's something. So this is a big plus to the church in the region, seeing that care reform really is real, is not just by mouth. So we see their father there, you know, there is Father Gishure, who is a consolator, has an institution, and when you see empty bed, shows you that he has embraced care reform, and most of the boys are now back to their families, and he's trying to see that he supports children from the family. And the other end, we see these are the children real who are integrated back to their families. These are the grandparents of those children. And we see those children are happy. At least, maybe right now we'll be talking of Sister Lucy having them, if they are from Mombasa. But the beauty is that right now they're in their families and they are flourishing where they are. The same, of course, we normally talk of that it's not possible for children with disability to be reintegrated. It's possible. Only that we don't have time. We would have played you a clip here, a video clip, of how a child with physically and mentally challenged, whom we reintegrated back to the family, and he was very happy with the aunt, not even with anybody else. So we see here those children, how happy they are. They might not be very, their family is not that maybe rich or whatever in their poverty, but they are happy. You see, the beauty of being with your people, your relative and all that. So looking at this, it shows us that many children we are reintegrating as per the CCC work. We see that a lot of children are going back to their biological families, which is a plus, because the priority is that children go back to their families, to their kins. Then we talk of alternative care if then biological family is not possible. But the beauty is that we are seeing most of them in the 3 countries. We have them biologically reintegrated back to their families. Of course, you might ask, where is Malawi here? By then, Malawi had just begun, so we didn't have the data of Malawi. I just want again to share the very statistics with children living with disability for us to be challenged. Maybe you don't need to answer or say anything, but just think and reflect over these numbers. It's huge, it's alarming. So what are you doing, or what am I doing in my capacity, in my little way or in my big way? As a priest, as a bishop, as a sister, as a lay faithful, what am I doing? As a chairperson in my Jumuiya or small Christian community, what am I doing? And of course, what we do basically is offering the following services that you find our children are in the institution because of education, healthcare, family counseling support, coordination of alternative care, and the linkages with other service providers. Because we all know care reform, you can't do it alone. I need you, you need me, we need the other person. The government needs us. We need the government, and all of us included. So basically, this is what we normally do to ensure that these children, as they go back even to their families, that education continues, healthcare and nutrition continues, support, psychosocial support continues, and the rest. So we ask ourselves in our program that how many staffs do we have? And are they qualified? Of course, it might sound so, maybe it doesn't add value, but it does. Because like Kenyan context, we talk of how many staff or the ratio of children to the staff. Those of us who are here, what is it supposed to be? The ratio of a staff to children in the institution, in that case. How many of us know? 1 staff to a ratio of? 25. Thank you. Another one? 10. Mr. Hari, uko na kazi. Yeah, I'll not tell you, but I'll give you an assignment. Yeah, but tukienda kumaliza, then we'll have to learn that. Because children are human beings. They are not sacks of cabbages or I don't know what, or potatoes. So they need care. They need specialized care. Each child is unique. And yesterday in the presentation we had it here, when Sister Lucy was explaining. Each child is unique, and that's why in case management we talk of individual child care plan. So we need 1 social worker to a certain ratio of children so that he can be able to offer the right service or help or support. It's not like one social worker, 100 children. My goodness. Hata kama ni mzazi, will it happen? Even if you are a grandmother, because a grandmother, you are a grandmother of many. It can't happen. So we wanted to understand this, and looking at this, we see that percentage of religious and lay staff in CCIs, this is how it looks like. And this also informed us that most of the sisters by then, when we did this, some were even doctors with PhDs, but somebody has PhD in mathematics, in physics, who is taking care of children in the institution. So will you be doing calculation of x squared, or you know the right support of this child who is challenged? Do you see the mismatch? And some completely, they had nothing. And because of evangelical councils, you profess today, tomorrow you are asked to be an administrator or a social worker in the care institution. Poor sister or poor brother or poor priest. You go there, you just offer the love you know. But now the question comes, I was happy here, my Lordship Bishop Mongelo, when he was talking of the problem is with us, because safeguarding, what are we doing? It's because of these things. We are doing it in the name of charity, compassion, charism, forgetting that we are doing it and we are causing harm. And one of the things we talk of principles when it comes to care of children is do no harm and in the best interest of the children. Are we doing it in the best interest of the children if we are just haphazardly giving anybody to take care of the children? Maybe yes, maybe no. But in the upper part, no. Because you need the right skills, right knowledge for you to be able to take care of those children. Now then you add your vocation of care and all that. I know the time, but Father, you'll add me some because you ate into my time. Yes. Yeah. Also, we looked into that and we went into capacity building to ensure that we have sisters to be trained in social work so that they are able to give right care. It's not just any care, anyhow, because case management, it's systematic. Care reform is systematic. So we need people with the right education profession. So in the region as we speak, of course, the number is more than 200. They might be even in 400, because like us here, we have like 12 who are going to graduate with degrees in Catholic University, just to have a pool of professionals who are moving care reforms. Then we've got 800, we've got 500 plus who've been introduced into safeguarding, because safeguarding is key. And yesterday, I don't want to repeat what Bishop already talked to us. It's key and it's important. Safety is key. Then sensitization has been also one of the things that we do to ensure that we win hearts and mind. And winning hearts and mind, we began with the congregational leaders, then we went to the communities, then we went to the government. Of course, government, when you talk of Mr. Harry here, he knows. But we go a chief who is also a government official might not be knowing. So we have to reach to them and the rest. So we look at least 6,000 stakeholders reached in the program. So when you talk of registration and all that, of course, in all these countries is different. In Uganda, we talk of they are still registering, but to ensure that they are operating within the law. In Kenya, we are not registering, but you are being only renewed, and to ensure that you are operating within legal framework. But of course, as a church, you also insist on canonical framework, because safeguarding is key. When you talk of Book 6, canonically, the changes that have happened, when it comes to reporting and all that, all of us have to know how do we go about when it comes to reporting of abuses and violations when it comes to the children and vulnerable adults. So there's a lot of robust gatekeeping, and that's where you see those empty beds. And we are talking of how do we now repurpose? Because our sisters are thinking, how do we repurpose to remain within the mission, but support the children differently, not necessarily keeping them. Then we see a lot of more systems, systematic record keeping. We have even digitalized our work in the region and all that, so we can happily share just by a press of a button what we are having as a data on the progress of the work that we do. And we see more family tracing, which is very key, because Bishop Muhere yesterday was asking, are we just taking children home? No. We ensure that we trace, that we identify what might be the challenges in the family, what are the problems that a child might be facing, how does the community look like, is it viable, who are other stakeholders who can be of help to this family and all that. So that is very key in our work, and we treasure a lot. So allow me just to peruse through, because of time, just to show you that how partnership is key and why the church is very important in care reform. When you look at those photos, might not be very wonderful, but they are good and they are key. The second one, we were in Malawi in Mangochi Diocese. This was a demonstration on how it was together with the Amecea and the KCCB family to see how can we as a church collaborate to see that a child is reintegrated sustainably back into their family. Because we talk of reintegration, just you have done it, but we talk of sustainability to ensure that this child goes back home and lives and enjoys and thrives. So we felt, how do we need to work as a church? Bishop was with us, with his team from the diocese. We have village elders, traditional elders, the government officials, the KCCB and all that, and the Amecea team at large, just to ensure that we together can collaborate to see that children go back to the family, because this is our pastoral issue. Maybe those who are not Catholics, you might not understand when I'm saying pastoral issue, but check with your friend next to you and ask, what is this issue pastoral we are talking about? It will be good for you to know. But we see the importance of why we should, all of us, be involved in care reform. These are our Christians, these are our children in our small Christian communities. As a church, it's no longer a work of sister alone to run up and down. It's the business of the parish priest, it's the business of that sister around there, it's the business of the catechist, it's the business of the bishop in the diocese, the chief, the traditional healer, or whatever they are. All of us combined, we can achieve care reforms, and that's what we are doing. And the government is key. And here we were in Nambale, just with the children officer DCS, to just see how our children are being taken back home. And there in Uganda, how other organizations are key in supporting our services, because you can't take a child home without anything. They need something, and they always look at you. In fact, you feed the child and the family at large. So it is key also, as we emphasize on care reforms, that we teach people on how to be able to vent for themselves. That even in institutions, they have to resource mobilize to know how they should keep this work alive, because it's not just empty hands we talk about, we need to do something. It's not only prayers, we need to do something. So we have to do that. With the care reform, it has given us an identity, it has given us a voice and a platform for religious and the Catholic community. So this shows that we have an upper hand to ensure that care reform is realized in our region and in our continent at large. And it's possible because we have seen that even Sri Lanka are doing it. And we need to retool. And retooling is just to ask ourselves, with the resources we have, what are we going to do in this century? And today, as we are here in Elysian Resort, so our good people, let's continue to win hearts and minds of all of us. It starts from the heart, it goes to the mind, then to the rest. It's not only about talking, but we need to do a lot. And just my parting remarks is that we have to ensure that safeguarding is key, care reform is key, partnership is key. And I need you, you need me, and all of us It's our responsibility, it's my responsibility, in my little way, in my big way, to ensure that our children, our families are supported. That poverty cannot make children to languish in the institutions. How was it that those years we never had institution? That's a question to answer yourself. You don't need to answer me. But just to assure you that it's possible, we have tested, care reforms are possible, and we invite all of us to champion or to work with us into this care reform. And I'm happy my lordship's present. Thank you very much. We used to walk alone as sisters and say, we don't know, we were always walking alone, but now we feel heavy and we feel supported in this mission of care reform or caring for the children or safeguarding the minors. So all of us, thank you very much for listening to me. I will be given time, I will have talked the whole day and given you real examples, but unfortunately I have to sit down. Otherwise, thank you very much, and the care reform is possible and it's our responsibility.
Let us appreciate sister better than that. Moja mbili tatu. Asante for that rich presentation. Thank you so much, sister, for making it real to us, and especially liking this very summary. Safeguarding is key, protection is key, and care reform is key. I know we have so many questions that we would want to raise with the sister, but I will ask you, you reserve them until that very time when we shall be having a panel discussion, so you can raise them. And because of time again, I wish to invite our two presenters, and time is against us, and so please make it a summary. So we have the privilege of inviting Musa Abdallah. Musa Abdallah, are you with us? Yes, an applause for Musa as he comes. A better clap. And you see Musa is suffering from the hand is suffering, so he needs a better clap so that he can recover fast. Or violent? Are you co-presenting with the other one? Is the other one only you? Okay. Sawa. Oh, okay. Thanks. Okay, sawa. Karibu Musa.
Can be great. This guy.
Electra, thank you.
Delete.
Good morning, everyone. All protocols observed. My name is Musa Abdallah Musa. I work for Catholic Relief Service. I support monitoring, evaluation, and learning. Father has said I suffer from violence. Also, just to clear the air, I'm an avid cyclist, I think in pursuit of happiness and hobby. So I cycle a lot. So it just happened in my usual route, they tended to include bumps, which I had not left the previous week. So that's how I ended up having a fracture. But also it was a learning session for me as an M&D who's doing monitoring, evaluation, and learning. I had not been monitoring the road. So I had been operating as if the road was as it was before, and that's how I ended with a minor fracture. But we thank God that I'm alive and I'm also doing well. I'm also very happy that Sister had started the session for me because I was a bit worried. My session has a lot of graphs, a lot of percentages. And I was wondering how best to approach this session to be able to have deeper conversation and at the same time not lose the audience with a lot of graphs and percentages. But Sister has really laid a nice foundation for me because she's given the portrait for the region. So the data that I'm going to showcase is actually going to go at a granular level in two of the archdioceses that we've been working in. That is Mombasa as well as Kisumu. As we said initially, that numbers do not lie. So if numbers do not lie, then the numbers that we are having at the regional level, at the diocese level and archdiocese level, should really fit nicely to the portrait level. So for that, I'll be able to take you through CCI situational analysis. CCI is Charitable Children Institutions. Then you're going to look at knowledge, attitudes, and practice survey. Then finally wrap it up with family life desk assessment. So for background, first of all, is just to understand why we conducted this situation analysis. What was our main aim for conducting this? And why did we do it at the beginning of our interaction with KCCB within the two archdioceses? Changing the Way We Care has also been working together with the government in 4 demonstration counties. That is Kisumu, Siaya, Kilifi, and Nyamira. In these 4 demonstration counties, we also conducted SITAN analysis, or the situational analysis. It basically shows us what is the situation of children within these counties. So when we were coming to engage with the church, this was also a very appropriate way to start the conversation. Because then again, how do you lay down interventions without really knowing whether there are gaps or how to address some of these situations? So it also acted for us as a baseline that would allow us as a MIL team to be able to measure progress over time. So it also allows us to do what we call transition planning processes. Because in the SITAN analysis, as we'll be looking later on, we will see how we talk to the CCI administrators and ask them, do they see themselves and their institutions beyond offering residential care to children? So I think it's also important for us because it allows us to know whether we can start embarking this transition journey together with the church. Now, I said earlier on that this data should actually fit into the regional portrait data that has just been presented, where Sister had showed that a great percentage of the CCIs are actually owned and managed by sister congregation. And when you look at it at the archdiocese level, that is Kisumu and Mombasa, I think it also speaks the same. It's only, you'll see that we conducted in 14 CCIs, and out of these 14 CCIs, the ownership, 86% are owned and managed by the sisters. So which also speaks to what was shared at the larger level. But this is also important because as we move down in terms of, at the granular level of the SITAN, we'll be able to also answer some of the questions that were asked yesterday by Senior in terms of the attachment, and probably clear a bit of also some of the push factors that are pushing children into the CCIs, and also ask ourselves, is it really the true situation? So also for me, showing this data is also to have a conversation with the audience, because at different levels, we are also interacting with children and institutions. So also as a sort of not verification, but also just chiming in for the same. So this is the total population of the children in the CCIs. I hope the colors are good. That's not one of my strengths in terms of the colors. So this is the distribution of ages of the children in the institution. I would like to bring our attention to less than 1 year, 1 to 3 years old, as well as 4 to 6 years old. So if you add the percentage, that gives you 20%. So it shows 20% of our population of the children. I use the mic. I think disability inclusion probably would need a little bit of help. That's on a lighter note. So yes, if you look at the percentage from less than 1 year old, 1 to 3 years old, and 4 to 6 years old, the percentage totals up to 20%. So that shows 20% of the population in the CCIs is below 6 years. So that also, we have to bring ourselves to the question of the development of these children at that early age. But bulk of the population is between 11 to 14 years old. we also thought that it would be befitting for us to have a conversation and just look at the average length of stay in the CCIs. Being a care reform champion, or all of us being care reform champions, we believe that children should take minimum amount of time within the CCI. But if you look at the length of stay here, you'd see a majority is between 1 to 2 years at 29%, but you also have those that have been there for more than 10 years, that is at 3%. But this data is not enough by just looking at this graph. I would encourage us to have conversation with the administrators who God has blessed to have them today in our presence. There's a beautiful story about the length of stay. Some of these children end up being here for so long because of also the circumstances that they found themselves into the institution. Because if you look at the case management process, we are talking about tracing and looking for, the first step is tracing. So sometimes you have a child who's been abandoned, and tracing really takes a lot of time. But then again, at care reform and the trainings we are doing, we know there are other forms of alternative care. And the trainings that we have put in place, we are expecting that this number will actually also go low. But also to bring to your attention about the occupancy rate of the institutions. Sister initially showed empty beds. My data also speaks the same to that. Because if you see, we have 36% of the CCIs have above 75% occupancy rate. So that means we have around 64% of the CCIs not operating at capacity. So which means children are actually going, you have to finish that with me. Children are actually going home to the families. So this data also speaks to what we have in terms of the regional portrait. Yesterday we had I listened into a very good conversation where we were talking about the reasons or the push factors of children to institutions. Again, I'm also bringing in a different perspective. Having conducted a sit-and analysis for non-Catholic affiliated CCIs, the push factors are a bit different. And I think the government is here, Senior is here, can also attest to some of this data. We can see that percentage of CCIs where children have been admitted because of access to health is leading at 34%. Access to education at 31%. Then I want to bring your attention to the third last graph, which is 7% poverty. But now the question is, do we really, if we unpack access to health, wouldn't we have some granular effect of poverty? Wouldn't we have granular effect of poverty? Because it just means probably I'm not able to provide scholastic material for my child. I'm not able to pay school fees for my child. So it also boils down to poverty. If we talk about access to health, it also moves into that category. But also to bring your attention to the disability, which is 23%. The CCIs we've been working with, some of them are offering very, very good disability services, that the numbers of children who are coming from the community are actually increasing. Our sisters here can also attest to that when we are doing some of the assessments. So again, the children being committed to these CCIs and seeking these services is because also the church is providing these services so well that the community is actually coming directly to some of these institutions. With one of our CCI also getting referrals from I think it's the county hospital, for some of these physiotherapy sessions. So again, the church is playing a pivotal role that the community is actually bringing children to the institutions. So again, it's, as we were talking about enhancing and having communications and conversations with the community, to also act as a gatekeeping, because the doors of the church are wide open and the services are good. But then again, how do we mitigate and manage this? So this is just a repetition of the other slide, just to showcase some of the services that are provided and by the number of the CCIs. So I'll not dwell so much on this, but if you look at religious services, this is well in line with what the church is doing. But you can see counseling and psychosocial support is also there. So these are the number of the CCIs that are actually providing this. And you can see healthcare, really, 10 of the CCIs are actually providing this, as well as early childhood education. So if you congregate this or just amalgamate them, it just forms to some of the push factors that we have identified in the previous slide in terms of push factors to the CCIs. This is a very good slide when we are looking at care reform journey. This is the CCI funding sources. So in our CTAN analysis, we ask the CCIs to tell us some of their funding sources. Where do they get their fundings? And what is the reasons why we ask this question? It's because if you want to transition these CCIs, then it's a journey that must be walked together with the donor. Because we are talking about supporting these children while they are at home. So our experience based on the non-Catholic affiliated CCIs is that you have CCIs where donors have individual children that they support in the institution. So when you have an individual child, the donor says, I cannot support this child when they go at home. I have to see the child in the institution. So then transition becomes a very hard task. But if you have a donor who's ready to support the child at home, then it becomes very easy. So at the CTAN analysis, it's important for you to ask, who are your donors in the CCI, so that you can see whether you can have a conversations with them or rather have a walk with them in terms of transition journey. So most of the CCIs, 9 of them to be specific, are individual donors and sponsors, and 7 of them were citing own income, as well as government funding and local churches. But this is very important because it also answers questions to the next slides in terms of visioning and having conversations with the donors in terms of transitioning. Another question that we usually ask is imagining the future, having a conversation with the administrators and asking them, where do you see yourself? Why is this question important? It's because it allows us to see whether the administrator or the institution can see themselves beyond providing residential care. And the responses were very good, because if you look at the survey respondents, imagine the CCIs being transformed to provide family-centered care. You see sustainable reintegration, educational transition, empowerment centers. But at the time we were doing this, most of the sisters or the administrators were already doing this, because they would tell you there are children that we have reintegrated and they pass by during school opening days to pick their checks. So already some of these things were happening. It is just a matter of really strengthening a few places. And we were also talking to them about what do you think will enable you to really achieve this goal of transitioning. And one of the responses was capacity building. So again, because of that, we have offered a lot of training, and I think Father Jacob yesterday spoke too much about the trainings that we've been able to offer, as well as sensitization. We've also done a lot of sensitization together with the church, and also family support and empowerment. This is one of those areas where there may need to be more resources put in place, because it means having services directly to the households back at the community. It is something that is happening, but also there was the need to ask for more from both from the government and other stakeholders, as well as the church. So these are some of the recommendations we got from the CTAN. One is awareness of harm to younger children in residential care, since 20% of the children in the CCIs are 6 years or below. Of course, we know some of the harms that are caused by residential care or institutionalization of children really happen at that very tender age. Because as the first presenter asked, what is the ratio of a child to a house mother or a house father? And the care that we all give to children when we have individualized children. So it's also important, but again, I want to also speak to the kind of awareness we've been having, because this is around 2023, so a lot of work has also gone down into some creation of awareness of this. Understanding of many children entering institutions to access to services which should be provided in the community. I think we have spoken to that, because if you're talking about access to education, these are services that the government as well as other stakeholders can actually put in place to curb some of the push factors. The last one I want to talk about is strengthening of gatekeeping to reduce unnecessary entries into the CCIs. One of the first steps that we have to do to prevent the push factors of children ending into the CCIs is actually gatekeeping mechanism. And this is basically, in a nutshell, just asking ourselves, does this child really have to end up in an institution? Or are these push factors that are pushing them things that we can address in the community? So I may not be so much privileged to speak to that, because I know government is so much into the gatekeeping and are able to speak much to it. So because of time, I'd like to move swiftly to knowledge, attitudes, and practice survey. So this is also one of the survey we conducted through the support of KCCB to just also look at what is knowledge and attitude and practice within the church. So I'll give a small background of how we went about it. So we can basically say that knowledge is what is known, and then attitude is what you believe, and then practice is what you do. So as M&D, we believe that you knowing and having knowledge does not really translate to practice, because attitude plays a clear and a critical factor. I can give an example. We may all know care reform and understand that we are saying children should not really, we are saying that residential care is not the best fit place for children, and children belong to family. But our belief could be different. And this could stem, and I can give an example. If you are running a rescue center where a good percentage of the children are coming from some forms of abuse, then it becomes a bit hard for you to be convinced that we need to do what? To go back to the family. And we are saying care reform is a journey. So these are conversations that we need to have. So that eventually has an overall effect in terms of practice, how you're going to do your things within the institution. So these are some of the key questions that we were asking. And then these questions were really based on 5 broad areas: family strengthening, reintegration and reunification, transitions of CCIs, family and community-based care, as well as child development. So we were just asking what are their current attitudes and practices around transition and family care, and how does this knowledge and attitudes and practice vary between groups within the church. Why are we talking about groups within the church? Because we understand within the church there are people who are directly working with the CCIs, and there are those that are not directly working within the CCIs. But at the end of the day, within the care reform journey, we are all working together. So we are all somehow contributing towards the same journey. So these are the characteristics of our respondents. Priests, we had 59%, sisters 27%, lay persons 10%. And then also just to bring to your attentions about where the respondents worked. 49% were not working within a CCI, partially 26%, and yes, 25%. This is very important because also when we're doing the analysis, we have to really separate the two groups so that we can see attitude and practice for those that are working within the CCI as well as those that are working without the CCI. So this is the graph. From the learning document that we were given yesterday, we have done a deep dive for this so that you're able to see the exact questions we are asking and deeper analysis of the same project. So again, it also shows the kind of work that was already going in within the church. And we can see where we needed to strengthen, and this is how we were able to tailor-make some of our interventions as well as our trainings. You can see for knowledge, child development is where we had a bit of issues, that is 59%. But the question we were asking under knowledge, we are also talking about stable connections. For example, asking a question such as, is it okay for a child to change caregivers during their developmental stage? And you'd find, because again, we are working within the CCIs, for example, as someone would say, if the caregiver is not taking care of them, what do? We can also transfer the child to another caregiver. But of course, knowing in terms of how the development of a child, that is not really the best form of doing. So that's why we have had a bit of a low score at 59%. Attitudes, where I talk about percentage of respondents showing positive attitudes towards family strengthening. You can see we had at 52%. Again, at child development, we are at 49%. Again, here we are talking about the question that we were asking is, can a child's need be met equally at the residential care institution as well as it can be met at home? And the respondents we are getting was at 49%. But again, from this at the onset, looking right now, if we were to conduct the same CAP survey, there's a huge difference because we've done a lot of trainings, we've done a lot of sensitization. So we are hoping at the end, by conducting this, we are going to see a significant change in terms of attitude change. So again, for practice, you can see there is a lot of positive practices that were already ongoing at the church at the point of administering this CAP survey, with family strengthening 79%, also 80%. This is split into those that are working within the CCIs as well as those that are working outside of the CCI. But then again, you can see the issue of transition coming at 22%. And this is for respondents working outside of the CCI. But also transitioning and care reform at that point when we were having this conversation was also a new concept. So this data really speaks to it. But looking at the kind of trainings we have put in place and actually have within the church, if we were to conduct the same CAP survey, the attitude is very different. The practices are also very different. So we are expecting to see a bit of change, not even a bit of change, but significant change when it comes to administering this. So what are some of the recommendations that we have? So one of the recommendations from the CAP survey is in terms of capacity strengthening of staff, both CCI and non-CCI workers, on early childhood development in terms of stable and consistent caregiving, as well as attachment. And this one has actually come in handy. It came in handy because we have done case management training with the church. We have also done alternative family care training with the church. For reintegration and transition, we have already done reintegration training, which actually is a subset within the case management training. For transition, we are waiting to roll out, the government to roll out the tools so that we can begin our training. And it's something that I am just from a meeting where we are together with the government in Naivasha. We are developing the tools. So this is something we are looking forward to having. Sensitization must target for the priests, sisters, CCI, managers, and social workers. Again, this sensitization have already happened. We have moved about with the help of Father Jacob and Elizabeth. So we've done almost all this sensitization. So again, at the onset, these were the recommendations that were coming in place, but most of them have already been achieved, given that we've been already implementing for close to 1 year. So I know my presentation is a bit lengthy with a lot of numbers, but I'm on the last slides. So the last bit of this is Family Life Department's capacity assessment. So through KCCB National Family Life Office, we're able to do family life desk assessments in different archdioceses. So I would just like to go through a few of the presentation. This is basically the background of it. Again, because of time, I'm really going through and skimming through this presentation. But a deeper dive and insight of this are within the brochures that we've been given. That will also allow you to see some of the logics as well as the questions and the deeper analysis of the same that we've been able to provide. So for this, we are assessing the capacity of the family life departments in 19 dioceses. And basically, we had a 4-point Likert scale, which is strong, good, weak, and poor. These were the ratings that were supposed to be done. And we were rating 2 main assessment areas. So this is team, resources, and mission, as well as services and networks. So I have 2 slides showing the presentation. 5 minutes, thank you, I'm almost done. Thank you. Average ratings, areas and dioceses. So again, this is just some of the average ratings. Again, we are talking about 4 being the highest possible score. And you can see in terms of team composition, we had 2.9, which is actually scoring the highest. But we also had mission, resources, and church support at 2.4, which was also scoring the lowest. But also let me shed a bit of light into that, where we are seeing mission, resources, and church support. When we're having this conversation with the Life Desk team members, they would say that the church is very, very supportive, having conversations within the church with the parish priest, but also citing resources in terms of them being able to expand more. So I think it's also good when you're looking at the brochure to be able to have a deep dive to understand how we have been able to unpack some of these ratings. In terms of where they are saying that there is support from the church, but at the same time, they're also seeing that there is no support in terms of resources. But then again, the resources they're talking about here is for the ability to expand to reach more people. So if you look at the brochure, you'll be able to really understand some of the nitty-gritties and the granular form of the data. So services and network ratings. So number of ARC and dioceses rated strong, good, weak, or poor for services and network assessment areas. So what we've done with this clustered graph is that we have one graph shows, when you look at the green, you have the 3. Then you have the other shade of green, I believe that's also green, with the 10, and then you have the color above the green, I think that's a blue. The 2 blues. Or that is not blue. It is blue. I've been advised it is purple. It is purple. Okay, the color above the 10. So so for you to be able to really understand the graph, what you do is you add the 2 colors below. That is the 3 and the 10. That gives you strong and good. So that's how you look at the graph. So you'll see this is 13. So you see under services, approach, reach, and feedback, we have a good and strong rating of around 13. If you look at the reach, we are seeing 14. And this clearly speaks to what I was talking about in terms of resources and support from the church, asking how best they can be able to expand their reach. Also, it's also important to talk about the networks. There was also the urge from the Family Life Desk talking about them being able to expand their networks in terms of working together with other people within their area and other couples and just reach bigger and wider audience. So I also think it's important for us to look into that. But deeper dive of this data, you can actually find it in the brochure and the learning documents that we've had. These are some of the recommendations that we got from the assessment. Recruiting additional permanent staff for the FLD. Again, it's also important to go back and check into the brochure because as an M&D, I think I like to expand on that. Some of the assessments we were doing, some of the Family Life Desk officers had been there for close to 8 years. So you would see they're already there. But again, the zeal of them wanting to expand and reach to a wider audience is what is actually bringing out some of these recommendations. So I think it's also important when you are looking at that brochure to also just have some of these factors in mind. Strengthening capacity to improve knowledge and competency of staff. So basically what they were actually asking for is additional training for some of the staff who are already within the Life Desk. And I think also improved funding. Again, I also spoke to this about the improvement of funding. It's just additional more resources for them to be able to reach a wider audience. So when we are looking at that brochure and looking at the Family Life Desk assessment, it would be prudent for us to have some of those factors in mind. Then it will be able to make a lot of sense in that data. I think I'm within my 5 minutes. Time is up. Thank you so much for listening to me.
Thank you so much, Musa. Now you can confirm that disability is not inability, isn't it? And better clap for him. Thank you for making it easy for us, especially understanding the research that you carried on knowledge, attitude, and practice. At least we know what is happening. We have our belief, and we also know what we need to do. At this juncture now, having appreciated Abdallah, and I think we can now appreciate him more. Moja mbili tatu. Good, asante. Now I want to welcome now the church. You know, they say where the bishop is, the church is, isn't it? Now let us arise. You arise. Oh, breathe in. You arise. Of course, I'm taking the position of Kivoi now. You should be doing this. Breathe in. Breathe in.
No, don't breathe in and out. Let us imagine you are driving, cycling in a slow motion so that you don't get an accident. Let us ride a bicycle. So ride a circle, it pole. Move your legs and your hands and your head and your ears and your... Are you moving? Some of us have never ridden bicycles.
Thank you so much. Thank you so much. Now I wish to invite our Excellency Bishop Joseph Mongela, the Chair, KCCB Commission for Pastoral and Lay Apostolate. Your Lordship, most welcome. From Rome. Okay.
thank you very much as they set up so that we don't take more time. And I hope that I will be within the limit. But I just say like one man, these two priests I know, one is very big in size, the other one is like a toothpick. So I asked them, the big one, why are you mistreating this other one? He said, why? You see me, are eating all the food. He told me, Bishop, no, I only eat my share. So I hope I only eat my share. Looking at this, the topic, from the heart of the church, family strengthening as a precursor for successful care reforms. Just in terms of terminology, the heart is very, very important. Then coming from the heart of the church, not from the head, not from the lungs, but from the heart, which is the seat of all the sentiments, the good and the bad. So receive it like you are the sweetheart of the church. Then the family strengthening as the precursor, Herod, coming before all else. Because you are talking about the child care. Even before you talk about the child, strengthen the family, strengthen the family. You know this, so that when the family is strengthened, then all things will work. Now, utakuwa hapa yako tunangonganga nikaika doti ama nigani, najua hivi vitu ya kuomba inakuanga na maneno. Just a few things, just because as I said, the story of the heart in the church. Then there is something that we call the importance of the small Christian communities, because that's where the family is, the family of the people of God, so that we work together as one person. And from the Amecea, just to, because the pastor coordinator is here, we are talking about the 50 years of small Christian communities. And small Christian communities were introduced so that we come learn, study, see what is happening, then see, judge, and act accordingly. And it is the people within the small Christian community which forms the church who have to identify the needs of everyone. As you have said, there are people who are there for welfare. Who knows what is happening? Is there enough water? Is there enough food and all this? Unless you see the needs of small Christian communities, we will not move and will not act well. We just come and gather and disappear. So let's also see we are celebrating 50 years of small Christian communities in our region. Then next week on Saturday, we are having our National Prayer Day in Kenya, National Prayer Day. We will also join those celebrations for Amecea. And the theme for this year is journeying together in integrity as a people of God, family of people of God. So you see how these things are related together, and you see speaking from the heart, strengthen the family and what has happened, and what we are doing so that we see even as a country, KCCB, what are we doing? What can we learn from the other regions in the Amecea, and what are we also teaching others, and what values do we hold? And the family is very, very important. Before I go into this again, just to remember, 1994, August, we were finishing in St. Thomas. 95, when we were finishing, and that's when Pope came here, John Paul II, for the Synod on of Africa. And again, the same theme of the church as a family, the importance of the family, and told us, let's not neglect the family, let's not abandon our values, let us not let other values come in and destroy our family. Very, very critical factor in our lives and the things that we do. So that was just a kind of grounding. And again, I'm here as the Bishop of Kitui, as well as the Bishop in charge of pastoral and lay apostolate. And all these things fall under the pastoral office. That's even my invitation. That's why I came there. It's a pastoral issue. We must handle it pastorally so that we know we are moving forward. Now, caring for vulnerable children humanizes and protects their dignity. That's why we are here. When we care for those who have no one to care for them, we share with them the love of Jesus Christ. Children are a gift from God that we know. Let children come to me. Let no one mislead these young ones and scandalize them. It's better for you to have that rope and millstone tied around you and be thrown deep into the sea so that we never see you again. And very, very important to care for children, again, to be childlike in our approach so that we can get to the kingdom of God. The care for children cannot be institutionalized, should not be institutionalized. Children deserve to grow up in a safe, loving, and caring family. Every child deserves the love of a parent, whether biological or not. Care for the orphan is associated with the purity of faith. The foundational principle in Catholic social teachings is respect for the dignity and rights of all children, including children with disabilities in whatever stage of their lives. I was in Ireland sometime. Then we went to visit a man who was sick in hospital. Then the wife had been there. So when we went to someone else, as we were going around, the man was crying. Literally. Oh, Mary, 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 Mary. So the nurse came and said, why are you crying? Why are you crying? I want Mary, I want Mary. As I said, where is Mary? She has to go home. The time for visiting is over. So I told them, please, calm down. You know, Mary may not be, but look at these beautiful girls, they are here. He told me, go away. Go away. I said, why? These girls are beautiful, but they are not my Mary. They are not my Mary. An old man who knows the wife is Mary, and no matter how beautiful you are not my Mary. So, the same story about the care, that the children need their homes, they need their families. The old ones, the young ones, we have much more at home when you are with your own. We are with your own. Yesterday I was talking about Swahili, but there's a Swahili saying about titi la mama ni tamu. Yeah? Hata kama ni ya mbwa. Yeah? Yes, in simple language that the mother's breast is the most beautiful thing here in the world, even if it is the breast of a dog. Even the breast of a dog. A dog is happier breastfeeding from the mother, not from your mother or my mother. Because my mother's breast is not as sweet as your mother's. I hope your mother's breast was that sweet and we are happy and brought up in our families. So this idea of neglect and what we need to do, rejection at personal level, we reflect on the best place to nurture and develop children within the embrace of a supportive family. So family strengthening should serve as a cornerstone of effective care reform. The family is not only a social unit, but the primary place of humanization, a source of love, stability, and support. Unfortunately, which is now the negative area, these things, because this is what we wish it will be, it is not always what it is. It's not always what it is. And we must strengthen because they are also like what we call the wounded healer, even you yourselves. You know, if we are measured how much loving we are and to others, how much is that? And we need to strengthen that so that children feel at home where they are at home and with their people. Some people told me never tell people to feel at home because it depends on how home is. Some of us might be happier here, and when you start going home, you start crying. So how do we make the family set up a place where we can say, feel at home, and I be feeling like I am at home? Providing families with positive parenting skills. These are some things that you have been strengthening. The family empowers them to care for their children. They should involve providing the resources, support system, and education that enables families to overcome their daily challenges. Providing families with positive parenting skills, socio-economic empowerment, psychosocial and spiritual support can improve their resilience. And this is what we are trying to do now in the family life in our KCCB. Family strengthening should help protect children from all forms of abuse and neglect. Now, of course, we talk about the church. Now we quote the Holy Father. In his apostolic exhortation, Amoris Laetitia, and I don't know many people read church documents. You can look for it online or go to St. Paul's and just touch it to say one time, Ilishika kitabu. Empowering and supporting parents should enhance their abilities to provide for the physical, emotional, and social spiritual needs for their children. Transforming our approach from institutional care of children to family-based care requires a shift. It is a shift to identify challenges that face families and the necessary support which needs to be given. The shift is to recognize families that need support and accompaniment. This accompaniment should help to keep more children in loving and safe families. It means seeing parents as part of the solution to their children's needs. When investing in family preservation and support, will prevent unnecessary separation and create an environment where every child has an opportunity to grow within their family unit. It also means enhancing collaborators among social services, providers to offer comprehensive support to families with continued support and accompaniment. The experience of love in family is a perennial source of strength for the life of the church. Amoris Laetitia 88. Children will find a safe, loving, and healthy environment to grow and thrive in their potential. You see, these things I will find will do this and this. You have to assess, as the CRS have been doing. When you evaluate, what do you find in all this which is happening? I'll maybe talk about this because I challenged the Gen Zs the other day. You know, they are seeing everything in darkness. You people don't know how to rule the country. You people, you are careless. You people, you are corrupt. You people, you are like this. Then you ask them, in 20, 30 years, when some of us will not be there, when they are there, how will they be seen by Gen Beta? Because now they have the generation Alpha, there is a Beta. Let me call it Beta, not than Beta. They could also, I don't know how Beta they will be. The generation Beta will be Beta or better when the Gen Zs are ruling. What is the answer? My friend, if now this generation, Gen Z, when they are our age, and the Alpha have grown, and the generation Beta have also grown, what will the generation Beta, the B, be rejoicing or crying because of what is being done by the Gen Zs at their time? Unless we prepare them well, we also into problem. So through the National Family Life Office, and our friend is here, Elizabeth, the Kenya Conference of Bishops has been supporting and accompanying families through different forums. These include programs such as positive parenting. I hope you are aware about that. It's in our diocese. The Faithful House, psychosocial support, and ideas of domestic violence interventions. Domestic violence interventions. You know, sometimes, and as champions and the things that we do, sometimes you can bring more problems than solutions in people's lives. Some people have said that, like, if you tell a woman, this is my wife, go to court, then take your husband to court so that this and this can happen. Arbitration sometimes is even better so that you bring people together, not just about rights, but also about the heart, how people relate with each other, not just as objects, but as subjects. I think mainly that's the office is developing guidelines to promote adequate marriage preparation and accompaniment. We are glad to support and care reform initiative which reinforce the importance of the family as the fundamental and natural institution for instilling values in the children and in their formation. This we need prayer, some of the things that we are trying to do, where we are and where we want to get. Just hoping that I'm still within my time. If we look at the challenge that we face and what we need to be doing so as to achieve this, reforms have not always been popular. And we are talking about care reform. Reforms have not always been popular because we are comfortable doing the things the way we do them. When they say there is no caning of children in schools, some teachers do not believe it because what is wrong with the caning? Because also in the Bible, that's what to say, that spare the rod, spoil the child. So you want to use it. But you know there have been many casualties because the teachers invented the cane, but also the cane has also sent some of them to prison. Yes, I told you yesterday, you come up with something, it might also do something to you. Look at us, the guys of Mombasa and the Shakaola. He said Kitawaramba, but it is Kuramba had him first. So it's not like this thing is going to finish you, whatever is going to happen. So reforms are not very popular, but they have also to embrace them with a positive change because not always the way you are used to doing things, there is always another way of doing things. We must learn from our mistakes so as to embrace change. And then, rather than just self-justification, how do you approach others and how do you listen to others? And sometimes you can go to what we call in church language polemics, self-defense. And I want to attack this one. The sisters want to attack the priests. The priests, they want to finish the sisters. The laity, they want to do whatever the priest is doing. Then this and this, we want to do this. The woman, she's saying, what a man can do, a woman can do better, can do better. And then the man is threatened. Then you'll have to go and do that in your mother's home, not in my home. And all these things that can happen. Also the language that people understand. That's what you understand. The violence, maybe you need a bit of that. But we must learn to dialogue, and then you reform where you know you have gone beyond what you are supposed to do. You listen, and then we change. Because change is very important, and change is part of reform. And when you change from the form that you are, please don't be deformed. Be reformed, because you can change for worse. You can change for worse rather than becoming better. And even when you are correcting people, correct them from the heart and with a good heart so that they also change and become better, because we can also harden people. We can also harden people. There was this girl we were in school with, the very hard-hearted, a crook. I don't know how they have seen crook of a girl. A crook. And in primary school, not in secondary school. And then this pregnant woman, my goodness, those things cannot combine. And she's on duty, and she's pregnant. And I don't know where bitterness comes from at one point. So he said, I'm going to kill you. Okay, that's my hand. Kill me. The mwalimu, the teacher, caned that girl until the cane split. There is nothing. Then she was looking, and then, are you through? Are you through? The lady looked at the girl and started crying herself. The teacher started crying while the girl was looking at her. So sometimes the things that you want to do, you can also harden the other rather than make them good. And part of the things that we do, we try to make these kids, bring them into a care center. And as I used to say when I was teaching, give us a boy and give us 4 years and pay school fees. And we will give you a gentleman, not a man. We will give you a gentleman. Then the time of integration with the family, that was in our junior seminar. I taught there for some years. Give us a boy. Give us 4 years. Do what the rest that you are supposed to do as a parent. And this is what we want to give you back. Not a boy, but a gentleman. Those who work in those institutions, the care institutions, when you are given this crook, you know, they are called brats sometimes. When you are given this brat of a boy, of a girl, what do you give me at the end? Hello? Now, am I still within my time? I don't want Kengelele. St. John Henry Newman, one of my great friends, he says this: to live is to change. Let us all say that. To be perfect is to have changed often. Okay, everything together. So you see the reforms where it is coming. And we must keep reinventing ourselves, reinvigorating ourselves, so that we move from good to better, then towards the best. If we don't embrace change, we'll just fossilize, we'll just decay, you'll be left by times. You have heard all these stories about change, about great companies at one time, including also the church. We were the best at this one point. Then you refuse to see the signs of time. You refuse to change with the times. Where are they? Where are they? They talk about these cameras. And what was that popular photography guys? The Kodak. Yes, you are doing very well, this and this. You know, if Kodak knew, and I'm not blaming them, they would have been the one inventing the phones and include these into their items and all this and this. That's why when you see every new phone now comes with the new products. Even your own app is always updating. We have your computer tells you to update. Whether you want or not is even updating you. And then you come, I thought I had the best iPhone. I thought I'd buy best iPhone. Hey, the other day, I tried to, to have it on. It tells me so many stories. And the thing now can't work, blinking like this. So I was told, no, my friend, this one is old-fashioned. You have to update it. You have to reboot it. Things have to be done so it can come to the modern times and the things that need to be done. So change is important. We must embrace it. We must work with it. I talked about people being afraid in terms of embracing change. In terms of the church, one of the great guys I love was John the 23rd. That man was made a pope in 1959 as an old man. He was almost towards 80. I think he was 79. Very old. What will this man do? No. We just want a stopgap. We want a stopgap. This is just a passing cloud. Let him come in, warm the seat as we look for a good pope to come and take over. That man shook the church. He just woke up and they were with the guys and told them, my friends, I feel like I need to call a council. What? We must bring the Second Vatican Council. And the guy said, okay, gave them work. Do this, like we're all here seated. Go and all these schemers. Go and bring us what we need to do about the new ways to care. They bring the same old stuff. You know, we fear to change. We need to do this. Bishop must be respected. Bishop is the church. After that is the priest. You must listen. The Pope is invaluable, this and this. He told them nonsense. Go back. Bring something new. I don't want rationalization. I don't want scholasticism. I don't want polemics. Just give me something which is pastoral, which is scriptural, dialogical for everyone, so that you can all feel at home in the church. Those are the kind of the things that we are told, even at family level, what we need to do and how we need to get this working. This idea of moving forward and reintegration, I had two examples here. One of them was a visit to committee, not very far from here. You can make a site visit. So as a priest, I visit committee prisons. And as we were there waiting, like here, some people, when they knew I'm a priest, oh, Bishop, pray for my husband. You know, most of them are men there. I think all of them are men. Pray for my husband, pray for my boyfriend, from my son, pray for this. Hey, so I had so much to pray for. Then somebody came and told me, just like, let me pick you, anybody. I said, now, please, Father, don't pray for mine. Don't pray for mine. I said, why? Why? Have you ever been conned in the phone, this and this? My husband is one of them. And he's here, maximum, whatever, sentence, life sentence. And you know, me, I've already integrated myself elsewhere. I already have another man. So, and this man sends me money regularly. I have a lot of money. And he thinks we are doing all these things. So if he gets out, I'm into trouble. I'm into trouble. So pray that he doesn't get out. You better do that, because that's one thing I disobeyed. I did not pray. I don't know whether he got out or did not get out. So manena integration and reintegration is something that we have to see. Another terrible one, maybe about prisons. I visited another prison. Then we were taught to reintegrate these people in their homes. Because I think this is just not just children, but everybody. So when we went there, this man was released and had to go home. So when we were going home, we had to go and visit the family and talk about this. So the woman told me, when that man comes here, my condition to invite him is that there are no questions. He should not ask any question. Thank you, sis. So when he came, he looked around, and then kids are going around, and then one came to him, and he said, and who is this? They said, he's one of us. And where did he come from? He said, while you are away, he was the one taking care of the others. So you learn that whatever you want that among yourselves. This is the integration business. It's difficult, and the situation that you find when you go back and what they need to do, so that as we prepare people to do what they are supposed to do and do it the way it is supposed to be done. I think that's mainly the thing. And back to Newman again. The things that he said was he loved to move from the heart to heart. His motto was heart to heart speaking. Call ad call loquitur, to heart speaking. I pray as I end this my presentation as a church that will be speaking from heart to heart, and that will never take children as objects, that will always be subjects, and that you love what we call vicarious vicarious celebration that you take yourself, like the other day we talked about Saint Padre Pio. That man had the stigma of Jesus. He had the pains of Jesus, was bleeding, like all the 5 wounds. That's what you call vicarious, like you relieve the life of Jesus, the life of the mother. Women, you have been told here, the sister, the number of which you are managing, you own and manage. I have 2 in the diocese. I can say here because you may hear about them. Nyumbani Village, one of them. Then we have also St. John Youth Institute, again rehabilitation, which we run by sisters, the work that's done. We hope that we are touched in our hearts and live with these children as our own children. If you are a sister, you are not a mother, such you are a sister, but you must be a mother to these children, and they must love you. And when they go and you are crying when they are going, and they are crying, leaving you and embracing you, is a glory. I think that's over with my time. I don't need an extra minute. We agreed that whether you are big or small, just eat your share. God bless you.
Thank you, Your Lordship. Thank you, Your Lordship. And better applause for our bishop. I think I should invite Kevoy to appreciate the bishop better. Kevoy, come. Oh, Kevo. But Kevo and Kevoy, are they any different? Oh, okay.
Let us prepare our hands to simame. You see, when the church is somewhere, you stand. This is where the state is here, isn't it? So we papasha. Put them together. Put them, your hands together. Rub them. We want to open Kadwan Rao. Kadwan Rao. Say Kadwan Rao. Rao is a hippo. How does the hippos, how do they vibrate? So open. Kadwan Rao. Kadwan Rao. Open wide. I'm not seeing people opening. Why are your hands? It means the caring here is not proper, so that we can talk with the caregivers down there to add something on. Kadwan Rao. Kadwan Rao. Kadwan Rao. Angusha.
Thank you so much, Kevo. Okay. Asante. Thank you so much, Your Lordship, for making it easy for us. I may not summarize all that which you've said, but allow me to say, change for good and better. To live is to change, and to be perfect is to often change always. Thank you so much, Your Lordship. I need your consensus here. Before I invite our dear lady here to pray for our tea, we have Father Augustine among us, isn't it? He's called Father Augustine. Father, August is among us, isn't it? He was to present before tea break, but checking on our time, we are late for tea, so we need to go for an energizer, and then we shall invite Father among us to. No, you don't know where it came from, isn't it? He was among the people, so that's where it's called Father among us. So, my dear sister, come and pray for tea. Yes, come. You pray for tea, and then I'll tell you what we shall do next. Yes.
In my religion, if we have a gentleman here, he takes up that role to pray. So, Musa, I can be by you, just to hold the microphone. Inclusion. And I am his sister.
I'm feeling very special with this cast. I hope it doesn't stop once I heal. So in Islam, when we want to pray for food, we just say, in the name of Allah, the most merciful, the most blessings, please bless whatever we have in front of us. Ameen. Bismillahir Rahmanir Rahim.
Thank you so much. So now we are going out for a break. And please, let us take the shortest time possible. Sister, what time shall we be back here? It's already 10:30? So we should be back here at Eh? 11. Eh? 10 to 11, isn't it? Sawa sawa. Asanteni. We can break for tea and then let us be here 10 before. And then we shall invite Father Amungast and Sister Monica to do their presentation. And then before then, I would ask you to arise. We want to sing a happy birthday for twin children, a baby boy and a baby girl. So, if you hear me now, rise up so that I tell you who our birthday boy and girl is. Victor, join me here. Victor, Sister Catherine, join me here. You are allowed. You can bring water, you can bring gifts. We are now celebrating two birthday twins. Sister Catherine, who is only 4 hours older than Victor, and Victor is born just now. So, 1 to start. That's poor note. Happy birthday to you, Wanda. 1 to sing. Happy birthday to you. Happy birthday to you. Not to me. Happy birthday, dear sister. Happy birthday to you. How old are you?
4 months old.
Only 4 months, eh? 4 months. Continue, want to sing? 11. Birthday to you. The bishop has something before they go back? Eh? Oh, cash. Oh, yeah, some gift, please. Okay, thank you so much. Clap for, yeah, that is good. Sawa, asanteni sana, asanteni. You can take your seats. Thank you so much. Good. Let us know who our birthday children have for tomorrow also. So at this juncture, then I will ask our technical person with the George Duku to play that video before I invite our presenters. That video, George, are you around? Okay, good. Play it. That video.
Throughout history, disability has been looked at differently. In some communities, disability was frowned upon, shrouded in stigma, stereotypical thinking, and superstition. Kenya Conference of Catholic Bishops, as part of her commitment in the Changing the Way We Care initiative, sought to change this narrative, to give persons with disabilities restorative dignity and include them in the life of the Church. In an attempt to live the Catholic social teaching principle on human dignity for all, KCCB conducted a comprehensive training on disability inclusion. The training aimed to equip pastoral agents with knowledge, skills, attitudes, and tools to create a welcoming environment for people with disabilities in our Church, enabling them to fully and meaningfully participate in liturgy and the life of the Church.
First of all, the parents and all of us have to accept that every human person is a gift from God. That's why we are living. And the parents should know their children are a gift. even if they are living with disabilities. Disability does not make someone half human being. They need our support. And in fact, these children, the way I see them, they have a lot of love. And we too, and the parents, should be able to love them. And one way of assuring that they love them is to bring them to the church so that they may participate in the life of the church. And more than that, we see, because participation in the life of the church is not only receiving the sacrament, but also responsibilities. Now, the children who are living with disabilities, if you come to our children mass, you will see them also participating. You will see either one or two who are ushers. Every Sunday, they bring forward gifts, the offerings. They bring them forward. And that is their way of participating in their small way. But it is indeed a beautiful way of praising and worshiping God.
When we had the Apostolic Nuncio in Mombasa, and he was doing confirmations in the cathedral, and 4 children who were living with disability were confirmed, and not just small or mild disability, even mental illness. And it was a very, very happy moment for the family, for the church, and for all of us. It was a breakthrough. And when I listened even to the parish priest, who is our Vicar General, explaining the journey he had taken with those parents, it was very, very fulfilling. Feeling like a parent could not go to church because you had to stay with your child at home. A parent, you go with some and not the others, so dividing the family. Now with the disability inclusion, they are all one family. So those children who were hidden and neglected have become a point of joy and a point of reference. Now it was a moment of joy for all of us. Yeah.
I want to talk about Daniela's confirmation. That day, I felt as if as if we are going to heaven.
I remember I used to celebrate Mass in my parish, that is St. Francis of Assisi Catholic Church, Rio. And I didn't know that we had some deaf faithful. And when I came back from the seminar that we had in Nairobi about, on disability inclusion, I began thinking of how of what I could do to make sure that this kind of people, they feel that they're part and parcel of our community. And after that, I looked for somebody I could take for training, to train as a catechist and at the same time to learn sign language, so that when he comes back, he can interpret liturgical, he can interpret Mass in a language that this kind of people can understand, and at the same time to prepare them for reception of sacrament.
Looking at our own preaching in terms of the content of our messages, that whatever you're able to preach, if you're giving a homily, it does not segregate. It does not depict a position that somebody feels like, I'm marginalized, or I'm in the other side of the divide, and therefore I'm not important at all. So we try also to focus on that. We also try to make some arrangements in terms of how do we reach out to them. In my parish, we decided, for one, to do the ramp for the church. It wasn't there. We have current plans of engaging also a sign language interpreter who will also be able to share, in terms of those who cannot be able to hear. So these are some of the things that we've been doing.
Inclusivity is part of us in terms of we don't discriminate people because they're weak or sick or disabled. We embrace them, whether they are men or women. That's inclusivity. That society decides we are working together, we are walking together, we are trying our best.
Following the training on disability inclusion, there's a growing realization that the world is one big exciting scene with all kinds of people. Some people walk on their 2 feet, others on wheelchairs, some have to communicate in signs and visuals, while others have to contend without vision. That makes us all special. To learn more or to get involved, visit our website and follow us on our social media. Thank you for watching.
That was good. A better plan for our technocrats. Thank you. We shall reflect on them, or even including other presentation. Maybe during the panel discussion, we can raise questions that you would want from any particular presenter. At this juncture, now I wish to invite Sister Monica and Father. That name? Father, you come and pronounce that name nice. Father, I'm August. Welcome. An applause for Father as he comes to share with us. Father, karibu.
Asante. So my name is Father August Mdavida. So I am happy to be amongst you. I want just to share my experience as a pastor, parish priest, about changing the way we care. But now here we are looking at those people living with disabilities and more concerned with children. When I was appointed as the parish priest in 2021 of our cathedral, there were so many children who were coming to the church, but they had disabilities, and you could see them seated in a corner, and no one was showing them any concern. And I decided to make announcements in the church that all those families who have kids, children living with disabilities, kindly bring them on Saturday so that we may have also special attention to them. And in one of our ministries, that is the catechetical and faith formation, we decided to have a special program for these children, and there were 11 of them. And one of the things we had to deal with, it was about some people who had that feeling that disability is a curse in a family. One time I asked my uncle some years back, why is it that in our culture you don't see so many with anybody with disability? I come from the Taita culture, and my uncle told me, you know, in the Taita tradition, any child who was born with disability was eliminated. They had to kill that child those years back. So you could not find anybody in the village growing with disabilities until the government now came in to straighten things and say no one should take anyone's life. That's why now we began seeing children with disabilities. But even with that, they were hidden. They were being left at home. No one was caring for them. So with that small experience at the cathedral, I had also to explain to our leaders, and it is good we have small Christian communities. And where you have small Christian communities which are functioning, I think that is one way of even educating our Christians from the grassroots and in all over the parish. And from there, we had now our teachers, that is trained catechists. 2 of them were sisters, and one we had a religious brother, and one is a trained also catechist. So they were dealing with these children. And what we were doing on Saturday, when they come to the church, they'll be given special attention, like making the sign of the cross, being taken to the church just to genuflect, to be shown the cross, that is the crucifix, and so forth. And from there, we saw that these children were opening up. And one mama asked me, will my child receive a Holy Communion? Will she be baptized? And I say, yes, this is a journey, and we shall walk together with them. And for 2 years, we were journeying with them, and then we decided last year, those who we baptized, and some of them received the Holy Communion, and then we brought them for confirmation. And what is special about these kids? We were looking at what we call abilities. Every child, these children have special abilities, and that's where we are focusing on. That's why if a child likes singing, we put him or her on that line. If they are good at bringing gifts, wherever the gifts are being presented, we give them. And every Sunday, good enough, their parents were very supportive. They give them gifts every Sunday, and they are there on the line. At first, you could see these kids were afraid even of me. But as time went on, I started interacting with them. Even high five, they will greet me. They will hug me and so forth. And from there, we could see a big change. And as we were planning that, we were discussing with priests, and they asked me, but now, will they give reverence like to the Eucharist? And we say, we have to form them. Because no one is born a Christian. You have to form faith formation. And that's why faith formation is very vital, proper faith formation. And even the day they were receiving first Holy Communion, something which struck me. After they received the Holy Communion, they will go slowly back to their seats. They kneel down, close their eyes, whatever they tell the Lord, we don't know, but we know the Lord knows their language, even though they don't utter any word. And from there, they felt encouraged a lot. And even other Christians brought many gifts to these children. And from there also, we encourage their parents that even for the normal school, they should also make sure they attend. And we could see the change even in the lives of parents. We could see also the change in the atmosphere at the church, that they were accepted. So, what I can be able to say or to encourage my fellow pastors and all pastoral agents, I see as a church, we need really to look, because as we are talking about caring or changing the way we care, there are so many kids maybe in our parishes, but maybe they are not brought to participate in the life of the church. As we say, the sacraments and even other commitments, because they are all human beings. So in the Archdiocese, we are revising our pastoral strategic plan. And one of the important things we are looking is how we are going to include people with living with disabilities, so that we may have them as an agenda, even in our parishes, so that we bring them to participate in the life of the church and see how we can be able to walk the talk of Christ, that love one another as I have loved you. So that is my little experience I've shared with you. Santen.
Thank you, Father. That's very rich experience. And better clap for Father among us. Thank you so much. I now, my humble duty to invite Sister Monica, and later I'll be inviting Marceline. Applause for Sister Hash. Welcome, Sister.
Thank you. As he has said my name already, I'm Sister Mary Monica Ogor, a Franciscan Sisters of St. Joseph. We are known as Asumbi Sisters. So for the bishops who are here, Asumbi Sisters are here. In case you need us, I'm also advertising, we are here. So I just want to talk shortly about the disability. But before I say about disability, I want us to look back. I think in 90s, there was a transition of something the Catholic Church had embraced so much on women who were widows and were brought to the Catholic, to the institute, to the church. We used to call them Mosiro. The women, especially those who maybe they didn't want to do some cultures, so they were rejected from their communities, and they could come and stay and stay and stay. Some could even come with their children, and children grow there and become living people, and later on they move. Before I started with the disability, I used to work with the people old age. And when the old age was being transited, it was not easy to remove a mama who had got a place and had settled and had been forgotten about her family and now was just living comfortably in the church. And now to tell her, go back home, it was not easy. And even now, as I'm saying, for us who have been working with children with disability, when we are being told, take this child back to stay or to learn at home, it is not easy for us. Just as Mr. Nyango had said, you feel that attachment. That attachment is with us and it is normal. So I want to just talk about mainstreaming and what we are doing with our place. I'm working at Sigomre Small Home. It is a diocesan institution. So I'm just working there. So in Sigomre Small Home, we are dealing with children with physical disability. But I'm not only embracing only children with physical disability. We go even to other children too. And what we are doing mostly, we are trying by all means that these children may be accepted in their families. And even as I'm here, I have maybe I will call her just before I leave, a parent who has accepted a child that even me, I didn't know that she could accept the child to go to a normal, regular school, primary. So what we are doing, we are trying to integrate these children back to their homes and not to stay with us, but go home and learn in the nearest school near their homes. We have integrated about 11 children, and they are peacefully living with their parents. Some are living with their grandparents. And as you know, especially in Luo community, if you give birth to firstborn child who is having any disability, that is already a problem. For you to marry that child must remain in your home. Is when you will get a man. If you go with that child, you will never get a man. So the only thing you do, you hide, and you don't become a mother anymore. You know very well you are a mother, but you don't become a mother. So what do we know? They normally do, they leave these children with their mothers, which means the grandmother now. And only when the grandmother is there. It is unfortunate when it is a grandfather. When it is a grandfather, it is even more worse. Because a grandfather with a child with severe disability, just have that imagination. Does it work? It is not easy. So you find that these children, when they go to school, especially regular schools, a child with epilepsy, if the teachers are not well informed, they will never accept that child. So what we do, we work with the community very close. We work with the chiefs, we work with the teachers, we work with the local leaders like maybe the clan elders, and also we work with the different faith believers. Like we normally work together with Anglicans, Pentecostal churches. We come together with them. Me, when I'm at home there, I don't put myself to be a Catholic. I am a Christian. Because these children are all Christians. So when we put them, these are Catholics, then the other denominations will not accept them. So I become a Christian. And I go to Chief's Barasas. My sisters who are here, go to Chief's Barasa if you have a problem. There is where you will get help, where these children can sit comfortably and stay comfortably, especially for adoption, even adoption. You can get at Chief's Barasa, because when you talk well there, a parent or a chief will even come up and say, may I have one child? Because some children are staying there because they have nobody. So with our children with disability in Ugonja, they have known me, because any meeting they have, even I have one here, whom you have just celebrated the birthday, is one of our children from the small home. Comfortably living at home, and is now independent somehow. Mama Kevin, my time is nearly cutting. I want you to come here and people see, is it possible that, just come shortly. It is possible, my dear sisters, that even a child with very severe disability can still also go to school. Mama Kevin has a child with spina bifida and hydrocephalus. But this child is totally on wheelchair. And you know, those who have lived with these children, you know how expensive they are. You must buy diapers. You must take care of because normally they develop some wounds. You have to take care of that. So she's just a simple mama with a small business, but she's taking her child every day to school. And she has to introduce her children to make sure that when they are coming back from school, they are not learning in our school. It is just another school, ordinary, regular school. So just greet them, and it's so that. It is possible. Somebody will translate what you do.
Kuom mano, nyalore mondo mi akaw nyathi kagoli small home.
It's possible to undertake care of a child. The other mbele nyathiwa.
Koro ne nagole small home. Katere is school ninga public.
I removed the child from small home and took him to a public school.
Kora nyaloga ome to duogo lunch nikech otiyo kod Pampers.
I always collect her for lunch because he is on Pampers.
Ne nawuoyo gi japuonj ni nyathini onego bed ni duogi dala nikech otiyo go Pampers, nyaka duog bolwokre kendo achaka duoke.
The direction is already with the school that the child must get back home for lunch break because he is ever on
Koro
Pampers.
japuonj ne penja gimomiyo nagole e small home. Nena neno ka en kod challenges mang'eny.
The teacher used to ask me why I removed the child from small home, Sigomre, because I'd witnessed he had challenges.
Nanyalo nyiewo ne Pampers koro katero ne tayudo ka obeti chiel mar small home. Koro ne ka penje to ang'o marach.
Anytime I could buy the Pampers and made a visit to school, I could find him seated by the fence and he could not respond as to what was wrong.
Nodwa bet go mame dala.
His response occasionally was he had wanted to stay home.
Koro naneno ka dok chien mare ne nitie school.
He was not performing well now in school.
Sister kawuoyo kode to ywaka.
Anytime he was engaged by the sisters or management of Sigomre, he was crying.
Kadok manye small home to kayude.
Sometimes he could disappear from the small home.
Iwacho na nen ka secondary.
He could move to secondary.
Kadhi ka secondary tanuange kuro ko bet gi jo secondary.
I could occasionally find him seated with the high school secondary students.
Konena to ywak.
Upon seeing me on arrival, he could
Koro
not
nadhi
cry.
awacho ni sister nadwaro ni mondo nyathini adogo e dala.
I made request to the administration that I be given back the son
Mondo atere public school.
so that she could take him to a public school.
Naneno komor.
And he was happy.
Kendo sani en free.
And he's now
Kata ka we dala to mor.
He's now very happy, even at
Asanteni
home.
sana.
Thank you.
And that was after the training on parenting. You know, when you empower them, they see the sense of having their children. So let us try to strengthen the parental training to our caregivers because it helps them a lot. What services do we give and what have we done with our small home? Although children have not all left, but what we are now doing, if the parents still feel that they need our service, they bring their children during the day, and we call it drop-in center. We have changed the name small home. Now it is a drop-in center, and then we give it a baptism Kargeno, a place of hope. So when they bring these children in the morning, they can live for us until evening. Then they come back and collect the children, especially those who are below 5 years old. They bring and then they leave. What do we do with them? We give them therapy, exercises, and maybe also, you know, these children need a lot of playing. So when they are at home there, they might not be having things for playing. But then when they are with us, we give them things for playing. And we have trained some of the parents on how to make things to make the children active. So we also go home. Like now, Kevin, we have given him a wheelchair that can take him to school, a mobility. And also, those who cannot stand, maybe that need a lot of frequent therapy, we train them on something called step. Maybe Bishop from Uganda knows what it is. It is something encouraging the parents to do the exercise at home. So maybe if the child needs a standing aid, we just go and cut the tree there. We make our standing aid. A child can stand there. And what I had learned, that when it is parents doing with the children exercise, they don't even cry, they laugh. But with us medics now, when they come to us, the moment they reach there because of the stretching of the arms, they just see that pain. But when the parents are doing it, they enjoy. So we like to train parents more to do that exercise at home than when they come, because when they have got used with the exercise, then it becomes easy. We also try to talk with the teachers to accept the children with epilepsy so that they may not see it as sickness. That is just a disability that has got a little time and it disappears. And also, what we also do, the chiefs also, we try to tell them to talk to the parents, to talk to the community, so that everybody is aware of the disability, so that these etiquette that they call them with the different names, they call them with the despise them or hide them, may not be there in the community. The church as a whole also now is accepting them. There is no prayer anymore because you can't correct a deformity with the prayer. It was only Jesus who did it. But just praying like some other denomination, we are trying to remove that from the community. Otherwise, my time is off. Asanteni sana. Let us join together.
Thank you, sister. Thank you, sister, for that ministry that you are doing. Let us applaud Father, sister, and that angelic mother. 1, 2, 3. Asante kwa kazi nzuri mnayotufanyia. So it's my humble duty again to invite among us Mother Marcelina. Marcelina, if you are around, you can. Yeah, let us appreciate her as she comes.
God is good, and all the time. Wow. I'm very glad to be here today, to be amongst you. I'm from the Cathedral, Mombasa, where Reverend Father Amugast Davida is my Vicar General. So my journey with my daughter Daniela, I have a daughter with Down syndrome. So my journey with her towards coming to church, actually Father Davida made it very, very easy for us. As a parent, you know you're in denial about so many things. How are people going to start looking at me in church with a child who looks maybe odd, misplaced, out of place? So he told us, bring your children to church. So I looked for time, and then I went and asked Father Davida, how do I start? He just told me, go and see the brother. I went to brother, and brother told me, can Daniela talk? No, she cannot talk. Can she express herself? I told her she's a very keen listener. She can imitate. She can do. She's a child full of life. They told me, don't worry, just bring the kids. Just bring, even if she can't do anything, or just bring your daughter to church. So I took Daniela to church. For mafundisho, she was there. The first day I wanted to sit there. They told me, no, why do you want to sit here and wait for her? Just come at 1. You'll come and get her. There'll be other kids. She'll be okay. She was so excited. So when Saturday comes in the morning, she just tell me, Mom, let's go to church. Let's go. I want to go to church. We go to church. She received her first Holy Communion, and she received her Kipaimara. I don't know how to say that in English. So her journey in Kipaimara, we used to go to church, and then when she comes back home, I'll ask her, so what did you learn in church today? And she'll tell me, in the name of the Father, and the Son, and the Holy Spirit, Amen. And then, what is your name? I know Mwalimu gave you a name. My name is Camila. Oh, so what is Camila? Mwalimu made me know that Camila is a saint of sick people. So she has changed. She is happy. We felt included in church. I'm very happy. By the way, I just like going to church. I just like want to be in cathedral. That is where I belong. Every minute, on Saturdays, I tell my daughter, let's go to the grotto. Who is that? Mama Maria. Okay, pray. That is what she knows most. In the name of the Father, the Son, and the Holy Spirit. For me, that's sufficient. I'm happy with it, and I can't say more. I'm just happy, and I'm very, very happy.
Thank you, Marcelina. Thank you so much. I think I need to invite Kevo to appreciate these beautiful mothers. Kevo, you have some design of appreciating good angelic mothers. Like, come. Kevo, isn't it?
See, Father, some are very nice stories that you don't want to appreciate. You just want to make them go inside you. But still, okay, we can. You are going to say Kalabanda.
Okay. Kalabanda.
Señorita.
Señorita.
So you Kalabanda. You are saying. You are talking.
Okay.
Kalabanda.
Kalabanda. Señorita. Don't. Now you be acting. You are the one doing it. The actions, eh? Kalabanda.
Let them wait. I do, then they follow. Okay. Kalabanda.
When people are standing, rise up. This one is a nice one. Yeah. So you do it.
1, 2, Kalabanda. Señorita. Kalabanda. Señorita. Kalabanda.
Señorita. Thank you so much. Thank you. Let us take our seats. Thank you. Let us also appreciate Kevo. So now, you know my mandate is over now. Clap for me also. So I want to invite John so that he may guide us for the next step, that we have a panel discussion so that we know what is ahead of us. Otherwise, we want to appreciate all our presenters. Thank you so much.
She's asking me to do exactly what I was thinking, and I know I will be out of order completely, but kindly allow me to get out of order and just ask that we interact with the sharings that have happened. We speak about it. We talk about what that makes us feel, because for me, the sharings that have happened can never be equated to all our PowerPoints. I want to take some few moments, just as that we reflect about the sharings that have happened, what that means for us, and maybe somebody will be inspired to do a little more than he or she is doing to be able to reach out to the people entrusted to our care. Allow me to ask in no particular order. If you have a question, fine. If you have a comment, fine. If you want to express your feeling, fine. I will not direct it in any order. I just want to ask a few people to share with us reflections from that sharing in your own words, in your own ways. Anybody? 1, 2, 3, 4, 5, 6. Let's make it very brief, kindly. Let's make it very brief. Thank you, in that order.
Yeah, huge thanks to the presenters and special thanks to our caregivers. It's not easy, but we really appreciate the sharing. My quick question is to find out whether we have the male caregiver involved in the process, so that as we see the female caregivers coming out strongly, are there any aspects of the work that has also brought in the voices, the participation of the male into ensuring issues, disability, they are also included? Because we know the role that the male caregivers also play in the process of upbringing children. Thank you.
Thank you. I'm not sure who is best suited to tackle that. But allow me to, even as we wait for her to share, the parents that have been invited here, we interacted with them through the process of the documentation, and that's how we were able to identify them and invite them over. I am pretty sure they are male caregivers, and apologies, we may not have interacted with them so directly to involve them in this conference, but I want to believe that, yes, Hadija, it's absolutely important to listen and hear the experience of the male caregivers, because we have quite a number of male social workers, and I'm sure they have an experience to share. If we have any such, I would be more than glad to create a movement, some few minutes of sharing. If you are there and you'd want to share your experience, we'd be more than happy to listen. In the meantime, allow me to ask her to share. Thank you.
Thank you so much. Thank you so much. First, I would like to thank Father David and Father Mdavida. You're doing a great work, especially for the deaf ministry. I'm speaking on behalf of the deaf ministry. That is one ministry that is very close to my heart. One, a challenge to our priests, because we are here because of families, and we say our babies should be raised in a family, but we have a challenge in the deaf ministry. One, because as we say, the kids will be better off raised in a families, but we have to understand a baby that is born from a deaf family, sometimes the deaf parents have challenges, so we do not have people to counsel them. Me, as a sign language interpreter, I will speak to them, but I do not know the pastoral language that is supposed to be approached to them, and how to tell them the family is the foundation of the church, the foundation of everything. So that's one thing that we are lacking. Secondly, on the sacraments, on how we catechize them. We have few catechists who understand sign language. For example, in the Diocese of Nairobi, we only have one deaf who is well-versed, who is a catechist and is also a deaf. So that's one challenge that we are having. So as we integrate them in the church, it is very hard for them to really understand the faith and to understand everything. I am a sign language interpreter. I am not a catechist. So I will interpret the mass. I will explain things that they're supposed to do. But you see, there's some aspect that we are leaving. So it's a challenge I'm throwing back to our pastoral ministers, our priests, and those who are doing this in the seminaries. Can we have maybe basic sign language, so that as we continue with the formation to become priests, so that as you finish, you can be able to interact with the deaf and also give them all the catechism that us, the hearing people, experience. Thank you so much. So for the family and the catechism, thank you.
Thank you, and my appreciation, especially to the caregivers and the parents who have been able to help the young boys and girls be who they are. First, I want to apologize. I'll take you back to what we did yesterday, but I feel it's something that is important and we need to have some clarification. Sometimes back, I would wish to share my experience. Sometimes back, when I was working in a certain parish, in the nearby sub-county hospital, a mother gave birth to twins, and she left the kids and ran away. Thereafter, the nurse calls me and shares with me the situation. So I told her that probably the best person to handle this would be the nearby CCI. There's a sister who is there. So I shared with the sister, and later on they contacted the children's office in the sub-county, and at last the kids were taken there. After some time, through my own investigation, I came to learn the relatives of the kids. So I don't know what happens if these kids in this CCI are adopted by a non-biological, by someone else, what would happen when the biological parents come to claim to have the custody of the kids? That is one. Number two, one of the sharing yesterday, in one of the sharing yesterday, we were told out of 2 kids in 8, okay, the idea was 8 kids. 8 have got parents, but the 2, probably they might not have, the parents cannot be traced. What happens to these 2? What happens to these 2? Where are we going to take them? Thank you. I think that was my sharing.
Thank you for those 2 questions and that sharing. I would want to ask, as you pass the mic, either I want to request my senior Konyango or Harry, either whoever would be prepared to respond. I'll give you a minute to respond to that specifically. But let's first of all listen to the others, just in case there are other issues that we may want to respond together. Thank you.
My question is about reintegration of the children from the institutions to their families or to their homes. It was highlighted clearly that children at home, donors may not like to support, perhaps only individual donors. So my question is, now, for the champions or the agent, what advice can be given to families so that in the near future they can be able to support themselves, not depend on the donors? Or for how long will this support continue to be done by the donors to the family? Thank you.
That's a broad question that is both programmatic and long-term. And the answer to that would definitely mean that you have to think about many elements of this particular program, including sustainability, including elements that Harry and Konyango will talk about. Allow me to ask Father Jacob if you'd be willing to respond to that. He's alluding to delegate that to Sister Monica or to any of the case workers. I can see Father is ready to respond. But I don't want to respond to the questions, not yet. I want to finish the 6 who are to share. Then we'll take the questions. There was a hand on that side. Sister?
Thank you, Father. Brother, for the chance. I would love just to share something. When the 2 mothers and sister were sharing, I felt a bit moved because I am a teacher working with the small children in the school, and I have less than 10 children with disabilities. These children comes to daily activities in the school. Others are trying, others have problem to move and even to talk. And these are the children, at times, when you see they have problem, you call their parents to come so that you explain and help them to help these kids. They don't come. And I have over thousands learners in the school. I can't move from one home to another. I actually felt touched. I was shedding tears. Now, if mothers cannot give that love to their children, what can we do? And I was asking myself, what can I do in order to help these parents, in order to help their children? So there are many in our case, come from South Sudan, especially in Juba. We have many of these. Some parents are not concerned. So this is actually also looking for help, as Father was asking, how do we get these donors to assist us in order also to help those children who are kept trying. They have desire to do something, to learn, but they cannot make it because their parents are not ready to support them. Thank you.
Thank you, sister. She's expressing a deep concern. And again, I'm not sure who is best suited to respond to her, but I guess it is more of food for thought for all of us, particularly those who are working with our communities. And I mean, all of us are actually working with our families and communities in different capacities. I think what she's driving us to reflect about is when that parental love is not accorded, yet the parent is there, how should the pastoral worker react? How do we react to that scenario where I have failed as a parent for whatever reason? How does the pastoral worker then assist me to take up my natural biological task that the Lord has given me as a parent? I think that's what she's asking. And those are things that we have to reflect about. Those are things we have to think about, because that is a reality of our everyday living. And those are some of the challenges that we may never even be able to put on paper and say these are the challenges that we face. But really, as she talks, she's able to help us connect with the everyday living of a pastoral worker, of a social worker, and just put us out there and ask how then do we help humanity to be humane? Thank you, sister, for that reflection. There's still one there.
Okay. So do I go, then I take up, then I give, or I take back the microphone?
It's okay, Edith. Your hand was up.
Yeah,
Please
sure.
go ahead.
Okay, thank you so much.
We'll take two more on this side.
Thank you so much, George, and I like the reflections going on. I had two discussion points, or rather reflection points, and I think the second one, as I speak to it, may answer some of the questions, like what the sister has asked and what brother asked. So one of the things I wanted to say is that I'm happy that disability inclusion is really taking root within the church. And it's not to say that it was not there before, but now we are doing it with a lot of purposefulness and with a lot of knowledge, because it's about also understanding. I remember when we started this work with Father Jacob, there was a time I posed a question to him that, is it possible to have disability inclusion introduced even right at the seminary, so that as people are being formed, they're able to start learning. And when they come out, they're able to start knowing even how to work around the faithfuls who have disabilities. But there's a difficult question I posed to him, but I don't expect an answer now. I asked, do we also allow people with disabilities to be enrolled? Is it called enrolled, or to be enrolled as priests within the seminaries? But I leave that as food for thought. But then I think it boils down to policies and the regulations, and also the capacity to manage people with disabilities. But I'm happy now within the church, we have a priest who has a disability, and that could help us now start learning from that. But having said that, I think as I was doing my presentation yesterday, I said that when we talk about care reform, one of the greatest drivers of child-family separation is disability. And that's why, as an organization, we are very passionate about disability inclusion. And maybe I would share briefly our journey with the Franciscan Sisters of St. Joseph. That's Sister Monica. Yes. So the disability work that started with that congregation, that institution, did not start with the work that we are doing with KCCB. It started much before. But one of the things I would say, based on what Sister has asked, is that we must appreciate that parents of children with disabilities go through a lot. They need support by themselves for even to support their children. So first we must understand them and give them the support to be able to support their children. What we have done before, we partnered with an organization from Uganda and we brought them in country to train social workers on EKISA finding value. It's a package, a very simple package to help parents start empathizing and understanding their children and finding value within their children. Then that, if you call them, they will come. Because already you're also supporting them. And it gives them some bit of self-care. And then bringing in the community, what Sister Monica was saying, the religious leaders, you must sensitize the religious leaders, but you must work with organizations of people with disabilities to do the advocacy work, so that the community is able to be acceptable. Remember, parents of children with disabilities have two types of stigma. The community stigma that is thrown to them, and the self-stigma that they go through. So you must support such parents to come out of that zone to be able to support their children. And then we got into the center, and it was a small home for children with disabilities, but we wanted them to repurpose that home to be a service provider. And that's why you had the services that Sister Monica was outlining. So we had to take them through a number of trainings and even supported them to equip the center with various machines and equipment that can service the children as they're taken back home. So it's quite a journey. You must work with various stakeholders. You must bring in all those people, but most importantly, work on the community and work on the caregiver. Then that child will be supported. Because if I'm a caregiver who is still burdened, I wouldn't even look for that service. Because first, there's still that stigma. So it has to come from empowering the caregivers, through first self-care, then getting into other empowerments like economic empowerment, positive parenting. I remember Adija asking about male involvement. That's a critical component of this aspect that we are doing, because most times when a child is born with disability, the first person who normally disowns mostly are the fathers. They say, this is not from our place. Some of them even run away, and then the mother is left with that burden. So you must also make the fathers accept that, yes, this is not the fault of the mother or the child, and make them also find the value in that child. So all that must come to play for you to start finding some milestones when we are talking about disability inclusion. No blame game. If you call me and I don't come, make me first work on what is making me not to come. Then I'll be able to come. But they are very supportive, and once they understand their children, they love them more. They really love them more. And these children, most importantly, they normally have a potential or a unique talent. Once you understand and you support them, they thrive. So I just wanted to bring that up so that we understand that it's a journey, and you must be deliberate and intentional even as you support children with disabilities. I hope I've responded to some of the questions, and I hope that's helpful. Thank you.
Thank you. Thank you, Edith, for those responses and the sharing. Kindly, let's make it very brief so that I give two more opportunities here, and then the last one. And kindly, you'll allow me to limit to the three. I'll give Konyango a minute and Harry a minute to respond to any issues that may have arose from this sharing.
Okay, this is input number 6. I want to nataka kumshukuru Mama Kevin for her resilience. She has taken us through school. I'm normally keen on the issue of the peculiarities when we are doing case management. She told us that Kevin could cry and avoid the colleagues at the small homes. And he would go to the secondary school where he could be comfortable. I don't know if the people at the small homes bothered, or Mama Kevin bothered to know why Kevin was uncomfortable in the small home and comfortable in the secondary school or at home. This one is very key for us, the case managers, so that we are able to package a very sustainable package of service that is sustainable to that household. So if we get that, I think what Kevin went through would mirror what other Kevins go through in other small homes or at the places of care. Thank you.
Thank you. Thank you for that. It just helps us to keep thinking about.
A participant had raised an issue regarding a case of child abandonment, the twins. I have a responsibility to respond to that.
That's okay, Konyango. Please go ahead.
It is important to take note, in the first instance, a crime had been committed. But I don't want to submit along those lines, because his concerns what happens in the event of adoption. So I'll go straight to matters surrounding adoption. The current children law Kenya provides for review of adoption orders on 2 grounds. If the subjects were lost, 2, if the subjects were abducted. And all tracing so occurred and registered with Secretary Children's Services that all that was never successful. And that information is shared to court. Then, Section 190 of the Children Act gives the High Court the authority to revoke such kind of orders, and giving, that law gives 2 options. 1, the subject of adoption can be given back to the biological parents. 2, court has the option of giving what we call joint custody. And where joint custody now comes in, if at the time the matter was before court, these children had stayed with the adoptive parents for periods amounting to 5 years or thereabouts or above, then court would issue joint custody. Or if it is in the best interest of these children that they still continue having relationship or contact with the adoptive parents, then court will allow that. Let me also take the advantage of the microphone and now ask, from the regional alternative care data that was presented by our sister, what came clear is there is low uptake of the alternative care within our region. Specific foster care and adoption from the statistics. And looking at that statistics, in Kenya, I would argue that the low uptake of adoption, 1, it is around the stringent legal framework. People in Kenya normally say that taking adoption to the High Court, the process is long, sometimes tedious. Some also go around perceptions that adoption is about buying of children and the stigma is real. Then they say it is expensive. But from the statistics, the uptake is low, and it is telling that as a region, we are not performing well in Pillar 2 of the care reform strategy. May we learn from other countries like Zambia, Uganda, those that are with us here. Why is this uptake low. In Kenya, I've given 2 or 3 reasons. What about them? Is it same?
Thank you, Senior. He finishes with a question to the delegates from the other member conferences. I hope within the process of sharing, somebody will be able to share that. I can see my sister is getting very agitated with me because I've not allowed her to speak. Her hand has been up for the longest. Can I kindly request that we allow her to speak? Then we will get the responses, because I think for me this is critical. It's important. Sister Euphrasia, you want to respond to Konyango? I am actually tempted to ask that we finish these two. There are 3 hands, because I had wanted to be finished with the sharings and we tackle the questions together. That may be a little faster in managing the. My sister is not lucky today.
Just to ask something concerning the issue of disability inclusion in the schools. We have different forms of disability. We have hearing impairment, we have visually impairment, and we have the handicapped. So you find in many schools, we have teachers who are trained on, who are not trained on special languages. And now when we are doing this disability inclusion, and we want these children to go to the schools near our homes. And you can find that those children, the handicapped children, they are the ones who are more advantageous in the normal schools than children with the hearing impairment and visually. So my question is the government planning to employ teachers to all schools across the country, those who have studied, the special language, sign language teachers, so that all these children can be supported and they can get all that they need to get from school. Because many teachers, they are not trained. Another question is, the care reform, is it inclusive? Because we are stressing on children in the institutions. We have children in this country who are in the streets everywhere. And we focus on children in the institutions not getting the basics from the families. And what about these children who are not connected to any program? And when we remove these children, because if we don't do this family strengthening, we are going to increase the number of children in the streets more than the children in the institutions. Another question is about the issue of Inua Jamii. I've heard of the program that is facilitated by the government of Inua Jamii. How much is it that is going to support these families and these children? Because, for example, you are a mother or you are a family having 5 children. You have one child who was in the institution. And this child is to go back and will have the services like in Inua Jamii. Now, when you look at the stability of this home, is this money that is going to be given by the government, will it cater for food? Will it cater for shelter? Will it cater for education? And is it enough to support our families so that they can be self-sustainable in the future, now and in the future? Thank you.
Thank you. I want to walk straight to my sister and give her my microphone.
Thank you, George. First, I want to appreciate the speakers of the day. And for me, the reflection that I've had from the discussion that they have shared today is that disability inclusion is very key. And from the first speaker in the morning to the last speaker, all of them have been talking about awareness. So I believe that awareness is very key in all the communication or the discussions that we are having with the parents, with the caregivers, with us as change agents. And two, I also feel that maybe just to connect to the question that Sister had asked, who supports the street-connected children? And we should not fear that these children will go back to the streets. I work with street-connected children, and what is very key is family engagements and also positive parenting for the families. And this one will also cut across to the families or the children that are in institutions that also need to go home. So when you engage the families and also the caregivers who are working with these families, then it becomes easier for you to move with these families to the next level. Then two, as Mama Kevin was speaking, I took this as a challenge, and I think this is a discussion that needs to be carried forward on issues of accessibility in school. From the discussion Mama Kevin had, I believe small homes must be having infrastructure to ensure that Kevin is able to move from one point A to point B and to point C. Now, when the Kevin moves to school, is that the same reception that this child gets in school? And this is, I think, this is a discussion that needs to be taken by NCCS, the Directorate of Children's Services, CRS, and KCCB, as you have engagements further at the national level. These are things that we really need to make schools friendly for children with disability. As much as there's a policy on education, on Education Act, on education for all, but if the environment is not good, then it makes these children maybe relapse, and also the parents to get tired of taking them to school because the environment in school is not that conducive. The last point that I also got from this is flexibility, and this one I've seen it from the priests, I've also seen it from the caregivers, and I've also seen it from the change agent or the institution administrators and also the social workers. So once we make things flexible for everyone, then I believe we'll be able to support these children to another level. Thank you.
Thank you. Thank you. I want to ask the last sharing from this end, then I will give some directions on how we move forward.
Very brief. I talk as a pastor and as a champion. The church has everything. It has good things and even those bad things and even those limitations. So the parish has, and as a pastor for over 38 years, I give you. So what we have here is a solution to what we are facing already. That's the first step. And because the church has everything, inagasia na mambo mazuri yote, so our solution is now to the KCCB. Is we meet these problems, we meet these impediments. Direct answers we cannot, but when we are friends as we are, we will manage. And here is where we are. A young man came to me who had already gone to the seminary, and he had to go to be a priest for the deaf. And he needed a recommendation, introduction for me to the bishop. Then I sent him to the bishop. The bishop told him, stop that and away from here. Such we have not heard of, and you cannot be priest. I cannot ordain you for the priest for the deaf. So KCCB, can we consider this? And I'm happy you are all here.
mercy. So as a pastor, we need such. I thank Sister Ludfin. When from the small Christian community, I got a child with impediment. I took to her, she's there, and I took to the center. She took care, then we took the child back to the family. And the child is doing well. So our being together and working as a unit will help us succeed. Thank you.
Thank you, Pastor. This is a beautiful sharing that is happening here. It makes me feel very guilty that I have to stop the sharing. Very guilty indeed. But I think in being prudent to the time allocated to us, you will allow me to make a request. Harry, I know we had wanted to respond to a number of questions. We have breakaway discussions in the afternoon. And those breakaway discussions serve two purposes: to allow us to share in smaller teams some of the questions, some of the views that we may have which we've not expressed here in the plenary, but also to discuss concrete issues and suggest recommendations as to how we can address some of the issues that we are raising. So if you would allow me, I would want to push this discussion into the breakaway groups. We will have 5 of them, and different thematic issues or questions, and we will guide. Then after those breakaway rooms, group discussions, we will come back and we will have a plenary that helps us to wrap up whatever has been generated from the discussions. So that at that particular point, we will give the government an opportunity to respond to some of the issues that have come within this platform, but also from the breakaway discussions. Is that okay? So that if you allow me at this particular time, I want to ask, one, to apologize to Elizabeth and the panel that was to come ahead. I have taken quite a lot of time on this, but I think it is for a good cause. So kindly, Elizabeth, I want to hand over the microphone to the moderator for the session so that you can go ahead. Thank you so much for that very rich sharing. It's very inspiring.
The moderators are changing now. Thank you. So before we break for lunch, we still have got one item. And George, 1 minute. So before we break for lunch, we still have got one item. So may I call upon Elizabeth Ngani, the program officer for KCCB, to help us in this presentation that is before lunch. And she will call upon the panelists to help us the discussion.
Thank you. Thank you, Father. Good afternoon. God is good all the time. Okay, so as we've been told, we are going to have a panel discussion, and we are going to have care leavers take us through this session. They'll be sharing with us their experiences from living in the charitable institutions that are Catholic-based. So the panel is going to amplify the voices of care leavers, recognizing their lived experiences as expertise, which is critical in shaping the care reform agenda. As defined by the National Care Reform Strategy in Kenya, a caregiver is anyone who has spent time in alternative care during their childhood, which includes foster care, institutional care, primarily what is known as the children's home, or other arrangements outside of their immediate or extended families. The Kenya National Care Reform Strategy recognizes the essential role of caregivers in shaping its development and acknowledges their importance in the implementation of this strategy. Our work aims to create a supportive environment that enables caregivers to engage safely and meaningfully. We seek to empower them to participate in advocacy efforts at both national and global levels, and to lead their own advocacy projects as people with lived experiences. This discussion that we're going to have now is going to focus on hearing from the caregivers who spend time, in the Catholic-run institutions, and this is going to build on other engagements we have already had with caregivers, including championess training, a recently concluded media interview with caregivers, which one of the panelists is going to participate already in the documentation. And so with this, I want to invite the caregivers. So the first one is Nelson. Karibu sana, and take a seat. The second one is Koki. Karibu sana. The third one is Oliver. Karibu sana, Oliver. Then the fourth is Victor. Karibu sana, Victor. And the fifth is Farida. Karibu sana. Let us appreciate them as they come to the front. So these are our caregivers. They are going to share with us their experiences from our charitable institutions. And actually we saw that some of the questions were asking, are we engaging families? And I'm happy that so far we've listened to parents. Have we engaged the children? Have we engaged those who have experiences? So here they are. They'll be telling us how their experience has been in the charitable institutions. I'll ask for the other microphone, kindly. Okay. So I'll be asking every caregiver a question, and we'll be inviting you to share with us. So the first question goes to Nelson. And the question is, as a caregiver, how well did the support that you received from the institution prepare you for life after leaving the institution? What additional support or resources would have made your transition more successful?
Thank you so much. My name is Nelson Apura. I'm a caregiver. I grew up in a children's home and stayed for about 13 years. So I'm also a social worker, practitioner. I graduated last month. As the question asked, how well is support received? Personally, I'm satisfied with the support because I got education. On top of that, I'm also a social worker. Of course, social workers are the one at the forefront for these care reform champions, and also what we studied in class as a social workers has also helped me a lot in terms of case management, follow-up, and Yeah. I have a quite number of support systems which should be provided to care leavers as immediately as soon as leaving the institutions. There's some of the support which should be just before and after, before leaving the institutions and after leaving institutions. Like for example, before leaving institution to their homes, psychosocial support should be provided, like train someone enough, like to be prepared mentally, because they have been in a children's home for quite a number of time, and now they have to go back to their new environment. You know, like because you understand, in a CCI, some of us, or most of the CCIs, you do not have to cook, you don't have to do what, you don't have, like almost everything is being done for you. You see, like to be honest, I've never paid my school fees. I've never went to bank to pay for myself. Everything is being done to you. What if this person is leaving now? This person is going to be a citizen of this country. How are you going to be independent, a person? You know, these are the things that care leavers or the children in CCI should be being prepared. In terms of savings, to know money, how money is, like how to spend. So care leavers should be taught well at the CCIs how to save, how to do this, and even the price of the items. Yeah, because everything is being done. To be brief, because I think I've a few time is not enough, and so most of the support systems are being discussed here, because we have care reform champions. So, and now I'm addressing the government office. I'm glad that the children office are here, social protections are here. So most of the questions that I'm going to address, it should go to government offices, because the follow-up, case management, reintegration process, NGOs and Catholics have done that. So the government now, the support system that we need from you, the Office of Social Protections, of course you have bursaries. So these bursaries should go to care leavers, those care leavers that have left CCIs while they were 18 years and they are not yet to finish the schools, because you understand, like CCIs, you are supposed to be at CCI children's home up to 18 years. So after 18 years, what are you supposed to do? And you are not yet finished school. So with the help of your office, you should have the database of the care leavers, so that and then have track records. Certain care leavers from leavers, certain care leavers are maybe like class 8 dropout, and how to help them. There's also NYS programs, KWS, Kenya Army, and Kenya Police. Should we have a slot for care leavers in this program, like special needs slot? Should we have them? I think I've thought of I know Jamie. I talk about the partnership in those NYS, county government bursaries as well as national government CDF. Yeah, so we should have this database so that we get to know the number of care leavers, their level of education, their needs, because of course, like so many of them have special needs, like in the disabilities aspect. We should have these people, like, because in the home they cannot alone manage to provide all the needs for special needs. So I think maybe if there any questions arise, we are here to answer. Thank you.
Thank you. Thank you so much, Nelson. Let's appreciate him again. Thank you so much for that sharing. We appreciate it, and I hope that those respective people who have been addressed have taken note. Thank you so much, Nelson, for that. The next question I'm going to ask, the question goes to Koki, and you can just give us your response while seated. And the question is, what role have caregivers played in the care reform efforts? How are your voices and experiences incorporated into the care reform process?
My name is Margaret Koki, and my question has three questions in one question. One, it is, what role have caregivers played in the reform efforts? Okay, one of the role that I have played as a caregiver, it's giving support to the young people into independent living. Sometimes I visit the CCIs, and I meet with different teenage boys and girls, and they ask me after when I left the CCI in our times, how did I manage to live and how was I coping with the life outside the CCI. So I always tell them the only thing that you can do is being disciplined and listening to your elders, those who are in your CCIs. And then another thing is the role that I have played is that I don't want all the kids who are in the CCI to end up living there for the rest of their life. You see, like in my case, I lived in the CCI for all my life until I finished the college. I had nowhere to go. I stayed there until I finished my college. And even now at this age I still go back to the sisters. So I always encourage them to go to the families. We have family members, those who can look after you. The support, sometimes we have like the sisters always send support to their families. So I always tell them it's good to go back to your family, because it's not good to be here with you. Okay, the people that are there are like families, but it's good to belong to a family. For my case, it's like we have some things that family needs to do them. I really gave the sisters, actually I was brought up by the Sisters of St. Joseph, a lot of job, because we have documents like birth certificate, we have documents like ID. The sister had to come up with those documents for me, because they couldn't trust family members. They couldn't find anybody that could assist me in having those documents. So the sister had to do that for me, so that I can have the document and proceed with my education. So that is what I always tell these kids who are in the homes. I tell them it's good to belong in a home, to belong in the family. It's not good to stay in the orphanage. You don't know your family, you don't know some problems like finding your own documents. It's really hard getting them. So I really gave the sister hard time in finding those documents, and eventually I got them, but it was really very hard in getting them. And then another one is I sometimes share my story to the society and encourage support to less privileged children. We have children outside there who are giving up in life Then sometimes I tell them, the only thing you can do is depend on God, and you just believe, trusting in God, because I give them my story sometimes. I always tell them, you see, I was brought up in this way. You have your own parents, but they are less privileged. They don't have everything to offer to you. But at least you have your own mother and father, or you have some sister and brother with you. So I always tell them to keep going and trust in God, and to keep applying for these scholarships if they are in high school, in colleges, and in university, and they do it. And then another question is, how were your voices and experiences incorporated into the reform process? Okay. My voices have been listened, have been in the reform process. The supporters who are helping us to reform have listened to our stories in one way or another. They have given us the way forward. If we share something that need to be discussed, they have always given us direction, and I'm very glad to the Caritas team. Sometimes I communicate to them more, because they listen to me and they give me the way forward. And I always like going to them. Sometimes I even call, not every time, but I always call them and tell them there is this and this. Okay, it is not easy, but they always come up with a solution. And I'm always grateful for them. Actually, I was introduced to them by Sister Elizabeth, so that they can listen to me and know the way forward. And another thing is being a role model to the community. You see, a lot of caregivers are not, people see them like, okay, let's say, these people are people who came from the streets. They're not responsible. They're not well-mannered. But for me, I always tell them I was brought up in a Christian way, and a very strict organization where we were told that this is where you're supposed to do things. This is where you're supposed to love people. The people that they are surrounding you in where you are living, you're supposed to treat them like this. Even if you don't like what they are doing, but you're supposed to be calm in every situation. So I'm always giving people a good image, because most of the people, they know that sisters, they brought me up, and they always they want to see that I'm not living in the opposite direction, because they really took us through a very strict reforming.
Thank you.
And then another question is, what could be improved in the society for us to, in the reform processes? One is to ensure that caregivers' voices are heard more powerfully in the formulation of government policy. The government should recognize us in a way that, I have one story I want to share it with you if it's okay. There was a time I was applying a document in the government, I don't know, parastatal or what. And then, you see, my documents, they don't have the full, let's say, parents. I have only one. Maybe the sister used one of her relative to find a birth certificate for me. That is from Taita. And the other sister, when I was finishing Form 4, she used her ID for me to get an ID when I was in high school. So when I was finding for that document, I went with the committal order, the letter from the sister, and also their ID, plus the other ID for the sister who actually she's no more. So this officer was telling me, how will I know that these documents are correct? Then I told him that I've been given the letter, this is what I can provide for now. He told me I cannot proceed with this, you have to go and bring more evidence to show that you are brought up from this institution. So I had to go back to sister, and then sister told me, what you can do, you go back to the children's court and get a document to show that. When I went to the children's court, they told me they no longer deal with the kids, that at that time I should go to the high court. I went to the high court, I explained my case, they wrote me a letter, and in my committal order they changed some things because it was not varying with the birth certificate. So he changed it, and then he wrote a letter to go and take it to the office. When I arrived there, he was not more convinced of all the documents. I had applied for that document for that 2021, and I got it this year, 2024, after the priest, the bishop, the secretary to the bishop contacted the organization. Yeah. So the government should. Yeah.
Thank you so much. Let's appreciate Koki for that. Such a touching story. And I can just imagine how many other children out there who have lived in the CCI and now, integrating the world out here and even getting very important documentation becomes a challenge. So I'm happy that we have the Directorate of Children's Services here and the National Council for Children's Services who can support caregivers in integrating back into the society. And thank you so much to the CCI that supported her so that she could even get the proper documentation, including the Archdiocese of Mombasa. Thank you so much, Koki, and let's applaud her once more. Thank you so much. So now we want to pose a question to Oliver. And the question is, how can we improve caregiver participation to make it more meaningful?
Thank you for allowing me to represent my experience. So my name is Oliver Muhanji, and I'm a caregiver. So as a caregiver, we have a different and a unique story which we tell to our communities. And I like to answer that question with my story. It will be brief. So when I grew up, at around the age of 10, my mother left me, so I lived with my grandmother. So my grandmother, it came a time that she wouldn't have a job, so I had to go to the institution, where luckily they accepted me, and they took me to school. So at the age of 10 to 22, I have never lived with my mothers. So when I reached 15, is the time that I went to the institution, and I went to high school, and sister, it was a sister. That institution was for sisters, so they took me to high school, and that period, I used to be involved with my grandmother because she was at home. So when holidays, I wanted to visit her. So we lived with her. We lived in the institution, and the holidays we used to go to see my grandmother. She was the only parent that I knew at that time, and also some small extended family. So when it came to high school, I finished high school, so I went to college. The institution supported me with that, and also the institution helped me to guide and counsel me. So I was prepared to go to college and also to go to life. So I was prepared very well. But when it came to my second year of college, which I was almost finishing, my grandmother passed away, and that came to it shocked me. And as we were preparing for the funeral services, so my mother came, and actually I've never seen her for those years. So it shocked me, and I didn't know what to do. And I also had siblings, so they were looking up to me, so they wanted to know what will we do. And they are small, so they can't make the choice. So they have to depend on at least me, because they only know me and they only know my grandmother. So it was so very difficult at that time, and I was almost graduating, and I had to make a rough decisions first so that I can go to college, and also my siblings who were not under care, because they were in a care, but due to some problems they were not able to continue to be cared. So they have to live with my grandmother. So my grandmother died with them. So then I had to take them. So my mother came, and so she said that she will take care of them. But I was not sure of that, because I was afraid, and she can took them, and then she leave them again, and I can't be able to go to school and also to look after them, because I was boarding in the technical college. So because I graduated, I have to go to home, and I was not able to go to the institution, because the institution has been relocated. And when you grow up, you need to have your support on. You have to work hard, and also to be able to live on your independence, because that time I was a grown up. So my mother, she had already taken them for like 3 months. So I wouldn't have gone to my mother at that time. So I have to look for another extended family. So I had to go to my uncle to live with him as I'm preparing to go to work. I was applying. I was already applying the job. So it wasn't easy for me to get the job, because we were going to the interviews, but we were told that we will call you. So when I went to my uncle received me well by that time. So those like 2 months it was good, because I was only waking up, looking for a job, and also coming back home. So I wasn't working at that time. So it came a time that my uncle and my aunt comes, and they ask me. So they started asking me questions. Unajua, in Kiswahili we say that there is a proverb saying that akufukuzaya kuambi toka. So they started asking me questions like, when will you marry? Okay, so those questions were so difficult to answer. So I told them I will work fast. Let me look for the job, get money, so that I can marry. So they continue pushing me to questions like, so it came a time they even asked me, so you need to look for a job, even if it is not that which you went to college. So I graduated, I'm an electrical engineer, So they were telling me to go and look for another job. So at that time I was so depressed and anxiety was killing me, so I had to go. So I was saving some money. I had some money because in some jobs still those are available. I used to work other jobs, small jobs which are related to electrical. So I had to move out of that house. So when I was moving in that house, so nearly those I wanted to. I was living in Githurai, down here. So I have to look for a single house, and I didn't have anything by then. So I went, paid the rent for the first month, and I bought one mattress. So I didn't know how to start. I even lost, because I lived in the institution of Catholic, so I used to have faith, but at that point, faith has gone. So I was not even believing like there is God again, because I was rich at the end and I don't know what to do. So my mind was telling me that I should just hustle, look for a job, any job. At that time, in the first month of when I took where I was living, so I used to go to construction of buildings. So to work as a hand, to help those masons. So I used to be paid like 500, 600 per day. So it was helping me at least I can pay my rent. But it was so difficult for me because I also have siblings, and my mother was telling me, I was also talking to them, so they was telling me that she is not able. So my siblings are almost going to high school, and they are also looking at me. So even now they also look at me so they want me to help them. My mother, she says that she can't have a lot of money to take all of them. So I have to support. In some way that I can. So it was so difficult. But luckily, I had a friend where we used to stay, and she called me, and we used to talk 1, 2, 3, and I told her that I don't have a job. So she told me that she connected me with someone who was able to at least put me to the electrical department. So when I started there, is when I started to moving to work with that person, because he was a freelancer. So we used to freelance with him. Till now, I do freelancing. So in this question, we as a caregivers, we are somehow, we get motivated when we are in an institution, but when it comes to an end, we are prepared very well in the institution, but the ending of the institution, we are not. Then you need the parenting of our, when you are going to reform, when we are going to get out of the institution, we are not families that are not able to tell, they are not prepared very well to accept whatever you are. So when you come there, they see you, they don't, well, first of all, they will not like you because you are going to be a burden to them. Most like me, I was a burden to my family. So, and so this when we I think we should be looking for the family counseling before someone is going to be reformed from institution to the to the families. So we also need to have we need to have a support structure, providing the resources and support a caregiver to participate. And also, I've heard my friend here saying that we should be like a cash transfer the Inua Jamii. So if the government can support a cash transfer, like Inua Jamii, some of our caregivers, we can be given money to stay. We can be given money to make your life at least better. But instead of doing that, we can also give money. That money you will be given so that you can start at least your own business, as your own business as the way you have learned. Like me, for example, I can start a business of electrical shop. Someone who has gone to college and done tailoring and that course, she or he can also start with that mini shop. So the government should also look for that cash transfer programs so that we can also help the caregivers. So like this awareness of the caregivers, so many people do not know this. Even if you go to the ground, those people there are many caregivers who do not know that we have something which is called care reform. They don't know that. And the CCI, I think they should be locating them so that they can be put together and also give the story that we have to share, so that it can be improved to help the courage and also to maintain their life. It should be also ongoing engagement like this one. It should not be a one-time. So it should be done regular. So the caregivers should learn more. At least we come here and learn some more things. When I hear the story of Koki and hear the story of my friend there, so we can relate and also learn from something, learn something through their experience. We should be also having advisory boards, which will help us and the caregivers to have a decision making at least, so that we can achieve our goals and dreams here. So we also have consultative workshops. Reform processes include where caregivers were called to we will be called to share our experience and provide feedback and propose changes. These sessions can help policymakers to understand implication to their decisions. I think it's also that, and thank you.
Thank you. Thank you so much, Oliver. Thank you so much, Oliver, for your sharing, and especially on what support you can get, including enrollment, perhaps into the Inua Jamii programs. I'm happy that we have here a representative from the Directorate of Social Development, and I know that that directorate deals with the Inua Jamii programs, and so our hope is that we can get some more support. I know the government also have, actually not the government, there's an association of caregivers, trying to also see, and this is in Kenya, I don't know whether in other countries there are associations, so having our caregivers join those associations, it gives them a platform to share and learn from one another, and they get a lot of support, in terms of psychosocial and, encouragement, and even to know how to maneuver and become independent and leverage on the available opportunities in the society. So thank you so much. Let's appreciate Oliver once more. And The next question is to Victor. And Victor, the question is, what kind of support systems do you believe are essential for caregivers as they transition to independency? What support systems do you believe are essentials for you as you transition to independency, but also what would make these systems more effective? You feel free not to tell us your personal story, but you know, from your experiences, what do you propose can the systems do to support more caregivers?
Okay, thank you. I'm Victor Tieno. I may say I'm a social worker by profession, courtesy of Sigomre Small Home. I'm also a computer expert, still courtesy of Sigomre Small Home. And that's why I'm here, because of Sigomre Small Home. I will look that question maybe in a different dimension. I may start by like a challenge or just a point of view. There's this thing called care lever. Are we aware that even down in our villages, is there any term called a care lever? Is there anybody in the society that knows there's somebody by the name a care lever? I think the first thing we should do is to do what is called sensitization. Who are these care levers? Where are they from? Why are they called care levers? I think if those questions could be answered, really care levers may enjoy themselves. Now, I want to start answering the question by echoing what Father Amogast said. It's really a touching story. He said he normally encouraged the persons with disability to come in church, and maybe if it's not the one, but there's somebody assigned to help them know why they are there. And this is called spiritual support. We need to be spiritually supported. Why? It's because we are transiting to be independent. How have you gotten that support? Or how have you gotten that strength to get exiting to be independent? Is because of the spiritually. Because most of the CCIs are faith-based CCIs. So with us, we normally get the spiritual support we were inside. But now you are getting outside. How are you going to support yourself? Or how are you going to behave spiritually with the people you are going to meet on the ground? So I will echo that as my first support that we need to be given. Number two, I will echo what Sister Monica and my sister Edith said. Stigma. This is social support. When we are under CCI, we really enjoy, and we are in a comfort zone. But now you are getting out. How are you going to relate with others? How are you going to relate with the society? In the CCI, it's a confined society, but now you are going to the bigger society. How are you going to relate with others? Edith says it's a stigma because you are coming from a certain stage, you are now going to the second stage. You are going to live alone. Yeah? How are you going to relate with the persons uko chini, the other side of the world? So the social support is most important. The next one is psychosocial support. Okay, most of the caregivers, they don't have their parents, or maybe they're living with the extended family. Take an example, you are coming out from the CCI. You get that the land for your parent has been grabbed. Where do you start? You start from nowhere. You only have two thoughts. Do I go back to the CCI, or I just remain outside and do 1, 2, 3, of which may be positive or negative? This goes straightly to maybe the government agencies. How are they handling these inheritance issues? How are they handling these inheritance issues? Your land has been grabbed. Your parents are not there. Where do you start? If you go to them, they will tell you, oh, go bring this document, oh, go bring this. And in real sense, you have not been able to have the documents. You are from the CCI. So this issue of inheritance should be more concerned to the government. The next point that I can say to answer the question is economical support. We as caregivers, we want to be independent. More so, we are going to have families. How are we going to handle our own family, leave alone the biological family or the extended family? We are now going to be adults. How are we going to handle our family? Economical empowerment means maybe the CCI has enriched you with maybe knowledge, skills to be self-reliance or self-sufficient. But now you are going out. How are you going to handle now the outcome of the CCI process? I think that could be better if it's taken into consideration as economic empowerment is the most essential support to caregivers to support themselves, support their family, and maybe extend the support to other caregivers. Okay, we are told to not to share the personal story, but a case study, if I may call it. And this case study is basically to either the government agency and maybe the NGOs. This issue of employment. Employment is a challenge to caregivers and is more challenge to persons with disability. For example, I'm going for an interview. Once I get into an interview, they will not look what I have. They will look for their appearance. Oh, this person has arrived here. How will this person handle maybe the job you have advertised? That is a challenge. And this is common with government agencies or government itself. NGO somehow is a bit flexible. They can consider because there's this thing now we call inclusion. Yeah? Disability inclusion. At least it's giving them a 10% out of 100 in marks. But how are we going to handle it? So my case study was this. Just allow us those persons with disability or a caregiver. If it enters into maybe your panel, don't look how the person is dressed or how the person walks. Maybe I may be using my third leg, other may use fourth leg or may wheelchair. Just give him or her opportunity. You will see this person with disability can even perform better than person that is the regular person. I may not call them normal. Yeah, the regular person, right? Just give this person an opportunity to perform whatever you want the person to perform. Thank you. Thank you so much.
Thank you so much, Victor. I think that message that he has concluded with goes to all of us. I know we have even had some people come here and say normal persons. So let us appreciate one another and respect one another and their dignity. So we are all normal, right? Everyone here, right? So thank you so much, Victor, for that sharing. Father, I know you want us to energize. I am actually borrowing a few minutes so that we finish the last session. Is that okay? Are we awake? Are we awake? Maybe I stand to see. Okay, let's just stand to appreciate what Victor has shared. I think that will help those who are maybe praying for them to now just join us. So let us stretch a bit. Just stretch. Just stretch. Are we stretching?
For those who are seated, I can see we are taking notes. Thank you so much. Let's have our seats. Thank you so much, Father Kevo. And I think just to emphasize on something that Victor has said, and I'm basing it on what Father David shared yesterday. Father said that in Kisumu, they've tried to incorporate the messaging on care reform even in their sermons and even when they go for burials. How many times do we go for burials and parents of children have died and these children are now going to become orphans, or even they will have one caregiver, one parent? Do we protect them from their land being grabbed? We will hear the relatives say that they want to push the children to the small homes or children homes so that the relatives can easily grab the land. So out of these experiences, I hope we are becoming ambassadors of even orphans or children who have no immediate or biological parents, so that their land can be protected. So thank you so much, Victor, for that sharing. And I hope that we are all learning from their experiences, and we have a mandate to lobby for laws that protect all children, and especially children with disability, but also children without immediate caregivers or parents. The last question goes to Farida. And the question is, how can religious institutions, policymakers, and other organizations better prepare children for transition to independent living before they leave care?
Thank you. God is good all the time. God is good, and that's nature. Wow, God is great. Okay, as they said, I'm Jerian Farida from Kisumu County, Nyabondo Center Rehabilitation Center for Persons with Disability Hospital, under the leadership of Sister Lord Finn, my mother that I've known all the years that I've been there. I've been there in my primary level, secondary level, and university level. So when I look at her, I see a true picture as a mom to me. Yes, thank you.
Thank you, sister.
Now you are saying that you want the transition to be done. Of course, we have enjoyed it, but we cannot say no, because it is also good to spend with our parents, because without them, I don't think we could be here. So it is also good to be with them and also to be with you. Yes? If you want to, as I understand the term of transition, if you want to transit me, first you have to tell me the reason, you have to give me the reason why, you have to challenge me, and you have to give me counseling first. Yes, you have to visit my home and see if the environment is accessible, and also prepare the parents. Maybe I don't have the parents. You have to prepare the community, maybe those who are going to spend with me. Yes. So as from my points, because I cannot master everything, I wrote them down. I'm going to read, and in case there is something that I can give as an example, I will give you. So my point one was spiritual guidance and support. Religious institution can provide caregivers with spiritual guidance. You can teach them on the do's and the don'ts. You can tell them that when you will be staying outside there, it is good to have good relationship with those who you are spending with them. Maybe you have a stepmother that is taking care of you. So you have to know how to relate with them. You don't have to drink alcohol or to be to have a bad friends that can influence you to do what is not good and For doing this, it can bring a sense of belonging, particularly during this transition. Another point, skill development. So you can teach these people on life skills such as cooking, doing the laundry, solving problems, because they are going to be independent. So in case of anything, they can be able to solve problems on themselves without bringing a burden to the community. Education and career support. Religious institution can help caregivers access education and career opportunities. This can include providing tutoring, care counseling, job placement assistance. You know, as my brother Victor said here, it is true. You know, if you cannot secure for us jobs, it is hard to get jobs. If the regulars get it hard to get jobs, who are we to get it? In fact, they charge us from what they are seeing, not what you are going to produce to the facility. Like, there is a case that I can say, I personally have done an interview. They just sent a link to the email, then they said, those who will pass this exam, they will be called, they will be shortlisted for physical interview. Then I passed the exam and I was called for that interview. When I went there, they said, we want a hard copy of your CV. Then I took a border. I went to a nearest cyber to print out the hard copy. So when I came back, I find everyone, the interviewers that we came together are not down floor here. So they told me that you have to go to 40th floor. That's where the interview is being done. Okay, that wasn't a problem to me. Maybe it can be easier if there is, how do we call it? Yeah, a lift. If there is a lift, you can go. But now I told them, how can I do it? We don't have a lift. Then which way can I follow? There was stairs. Stairs without handrail. You can imagine the situation. Meaning that still among us, we have those who don't know that people with disabilities exist. That's why they cannot even. I'm happy for this restaurant that we are, a resort, because we can access every places. Thank you for doing that for us. Thank you. Imagine if I could pass that interview. I had already lost hope of that one. Yeah. Financial support. When I was talking about financial support, you know, people were like, are they going to manage this one? No, you have to give the literacy about this financial support. Policymakers can ensure that caregivers have access to essential services such as mental health counseling, substance abuse treatment, and job trainings. Yes? So you can give, if you want to give this finance to the person, first sit with these caregivers, ask them what they want to do in future. Because not all those that you have trained that succeed to go to high level of education, to have certificates, to look for jobs. Maybe you can teach them on handwork skills, yes. So you have to ask them, what do you want to do? You hear their views, then you can advise on how you see. Because if you don't do this, you will give them this money, they will spend it, they will come back to the facility asking you for more, or they will give burden to the community. We have data collection and research. Policymakers can collect data on outcomes of caregivers to identify areas where improvements are needed. This can inform policy decisions and ensure that caregivers receive support they need. And I think policymakers, you can use the CCI because they're the people that have been with us. They know their children, so you can use them to get these caregivers. Collaboration with religious institutions. Policymakers can collaborate with religious institutions to leverage their expertise and resources in supporting of caregivers. This can help to ensure that The needs of this vulnerable population are met by working together with religious institutions. We have sensation for caregivers. More awareness should be created concerning caregivers, with the caregivers. You can do it in many ways. As I see my mom here, Sister Ludfin, normally they do outreach, yes? Now, I think so many people knows our facility because every month, every week, I don't know, it is 2 weeks in a month, they do that outreach. Now people are aware about the facility and how they should be doing. So if you walk out there, they cannot see that, oh, which creature is this? Are you coming from hell? They know us. Yes. Promoting exclusion and equality, disability mainstreaming to ensure equal opportunities are included. This one I cannot talk about because I've already talked about it. Building a more accessible society by raising awareness of the barriers faced by people with disabilities, as I said about the stairs. So you can put ramps. If there is another side, you can go with stairs, and we have a ramp and lift. Yes. Advocacy. Now our voices needs to be heard. Sometimes I really wonder. I don't know. Sometimes I ask myself, if we have really those people with those persons with disability that are working in the government, why don't you fight for us? Because our voices needs to be heard. Our voices needs to be heard through you people. It is not good. It is not good at all. So religious institutions can advocate for the needs of caregivers and work to raise awareness of the challenges they face. This helps to ensure policymakers are responsible to the needs of this vulnerable position. We have comprehensive transition plans. Policymakers can require care providers to develop comprehensive transition plans for caregivers. And the plans such as educating vocational and housing needs. You know, these vocations will help those who have not managed maybe. As I said, not everyone can succeed to high levels of education. So we have to understand those are also our sisters and brothers. So we have to come up with something that can help them too. Also, I cannot forget about myself because as you see, I'm the only person who has 4 legs in this house for now. So we need assistive devices. As if you want to transit these people, how will they be moving when they are outside there? You have to give them wheelchairs, crutches, all that they use for moving from one place to another. Yes? Even the tricycle for persons like me. I can use tricycle maybe for long distance. Instead of taking boda every day, you know I have to spend a lot. Maybe you don't have that money to spend. So I think these are the things that you have to check on because with me, I am this person who have gone through these things and it is even in the Constitution. If you read Act number 14 of the Constitution of 2003, you will find all this that they gave out to support persons living with disability. There is those resources, assistive devices, employing these people, which is not taking place for now. So I'm asking let me thank the CCI because I can see that most of us that are here, we are being helped and promoted with the CCI. They are the people who have made us to be where we are now. If the government, I'm not saying that you are not doing it. Yes, you are doing it, but still you need to put more effort on this because all that my people, my brothers and sisters that we learn together, no one is telling that is employed with the government, maybe in a government facility. Why? Meaning that you are sleeping. I'm sorry, you are sleeping. So you need to wake up and help these people. Don't leave the burden to the CCI. Yes? And You were talking about enrollment. I don't know. There is a case that was shared there with mothers who have children with disability. It is true that these people are traumatized and they have stigma, because sometimes in our facility we have those who bring children for mental check-up, for physiotherapy and occupational therapy. So when you interact with them, I did not tell you, I've done informatic management, so I do work together with the patients, yes. So when you ask them about you ask them to give you the names, they will only give you 2 names. Then you ask, and what about the name of the father? They say, no, just leave that one aside. Then I saw that these cases now are increasing. I decided to ask, you mean you people, you just give birth without someone? Then they were saying, I was staying in Nairobi with my husband, and now he said that it is good that we go back home, where we come from. And then I asked, okay, so did you go back home with the husband? No, he left, and now I'm hearing that the husband is back to Nairobi with another wife. But why? Because you have given birth to a cerebral palsy child, a disabled child, and this man is ashamed of having such a child, so they leave these mothers with burden. And this is a child that has a cerebral palsy, you know, they don't have that sense that now I want to go to toilet, I want to go and urinate, they will do it on themselves. So these people, they need empowerment. Thank you. I finish by saying that being a disabled, being what you are, it doesn't make you less human. You are human. Thank you.
Thank you so much, Farida, for that sharing. Let's appreciate her once more. I kept looking at Harry when Farida was sharing. And I know that because of time, I would have really loved to give Harry a chance to just, encourage the persons with disability, but perhaps we will see whether we will get time for that. But he is working with the government, and he's a great champion of persons with disability. We've gone with him to our trainings on care reform, and he has encouraged so many pastoral agents. Maybe the question is, Harry, have you gone to encourage caregivers? Maybe that is the question now we are asking ourselves, and especially caregivers with disability. So thank you so much, Farida, for that sharing, and we appreciate even the sisters who have given you an opportunity, even Victor, and all of you to be able to, find a job and make a living. Madam Koki, you want to say something? Do we allow her? Yes. Thank you. Okay.
Okay, I want to thank the Catholic Association. All over the world, doesn't mean Kenya, Tanzania, Rwanda, all those countries that have been mentioned. The Catholic has really been into us a lot. I have a lot of brothers from Sister Jane that we went through the Catholic institution. So I want to thank you, and I want God to always give you that heart that you have to pass it to the others that are coming. To the sisters, it doesn't matter which sisters, which they are coming from, which part, either the sisters of Claration, sisters of Precious Blood, and Joseph, all of them, they are doing an amazing job. To the priests, to the bishops, I just want to continue with the same spirit and to continue preaching, to have moyo mkunjufu.
Thank you so much. you so much, Madam Koki. And my prayer is that as we continue these deliberations, we'll find more time to support caregivers. Thank you so much for sharing your experiences. We are sincerely grateful. And I have been told by the moderator and the timekeeper that our time is up. We will give you time to maybe share when we come back. Nelson, thank you so much. Let us appreciate them as they take their seats. Thank you so much. And now I hand over the mic to the moderator to guide us. Thank you.
Another round of applause. It was indeed a profound sharing. Like our bishop had alluded to, that we need to share and talk from our hearts. So thank you so much, Elizabeth, and the caregivers. And it also gives us some hope and encouragement, especially seeing that they are in their mornings of their lives. Before we go for lunch, may I call upon George to give us some announcements, and I'll ask our bishop to lead us with a grace before the meal. He already celebrated Mass for us, and we are nourished spiritually. Now he will say grace so that we can be nourished physically as well. George.
I will be very brief. Just a quick announcement about our afternoon. We had mentioned that we have breakaway rooms. We have rethought a few areas, and we want to suggest that we have 3 things that will be happening concurrently. In the main hall here where we are, we shall have somebody from the government, a government officer, who will help us to unpack alternative family care options. We have talked about one, adoption. There are quite a number, and we felt it is important for us to be assisted to unpack what are these alternative family and community-based care options that we have. And Mr. David will be here within this main hall to help us unpack that. If you would be interested, we will request you to join David, and the rest of the team members will be here in the afternoon. We have another hall which is on this side. It's indicated Dr. K. Monga. Dr. Monga, it's just where we had packed a number of our materials, not far from here, along this corridor on my right-hand side. We shall have a discussion that will be happening there on the role of the church in promoting alternative family and community-based care options, the role of the church. We asked Teresia CRS, we will ask her to help us moderate that session or that discussion. And then I will ask somebody to take notes. I will assign someone to take notes for us. We have another hall. As you continue around the corridor, there is a hall on the extreme right-hand side, indicated Cardinal John Jue. We shall have a track number 3 that we will ask Father Silvanos to moderate kindly. I know that's an ambush. My apologies. But anyway, I know Father will allow me to ask that he obeys me. my bishops are very sorry. Father Silvanos will ask him to moderate that group. And we will ask Sister Clara to be taking notes. We will ask Sister Clara to take notes. And the discussions that will be happening in that hall will be around opportunities, challenges, and lessons in promoting alternative family and community-based care options. So our discussion in the afternoon is centered around these alternative care options. In the main hall, we shall have a government officer who will make a very quick presentation and then respond to questions that we may have. In the other hall, Dr. K. Monga will have a team of people who will be discussing what is the role of the church in promoting these care options. And then we'll have another group that will be discussing what are the opportunities, what are the challenges, and what are the lessons we've learned around promotion of alternative care options, which are family and community-based. Now, we have decided that we're not going to divide us into 3 groups. We will ask you to join any of the teams that you wish to participate in. That's the difference. We had initially thought we'll divide us into distinct groups. We have thought otherwise. We will ask you to join any of the 3 groups. Thank you. This is 32 minutes after 1. We're supposed to come back at 2:30. Is that too much to ask? Plus 30. Father Kevo now.
So we come back at 3 p.m. Last announcement has to do with some business that outside.
I want to make a suggestion that if we can attempt to be done by 3:45, so that I ask the others to rejoin the plenary. Thank you. Hadija, you're here? We've done up to 3:45.
Very fast, eh?
Yes. You're not in this group. Huh? There's a group. Amecea. La Benson, sawa.
Good after lunch. Yeah, I want us to look at alternative family options in the context of Kenya. And I know that after this presentation, probably may also have other presentations, but we want to look at okay, I hope I'm now audible. Yeah, my work is actually very brief, just to be able to see how we are carrying out care reform in terms of alternative family options in this country, and it is going to be brief, so I would wish to request that we be keen, especially if we want to get something. As we shall be looking at these alternative family options, may I also register that I may not be able to go into the details, because if I have to pick one, probably it may take like more than 2 hours just to talk about the same. So whatever we shall be doing here is just a brief, so that we can be able to understand where we are coming from and where we are heading to. Yeah, so alternative care as prescribed in legal documents, we are well aware that as we are actually carrying out this care reform agenda, We have legal instruments that are guiding us to be able not to go outside what is entailed in the law and policies of this country. So we have our Children Act of 2022, which is actually helping us to be able to carry out alternative care, and it could be informal and formal. Informal in the sense that there are those that we've been practicing, not exactly knowing that we are actually in care reform, but it is something that we've been doing along the way. We also have the Constitution of Kenya under Article 53, which is enlisting some of the children's rights. And when you look at Article 53 of the Kenyan Constitution, especially sub-Article 2, it is emphasizing on whatever we do for the child, it must be in the child's best interest. Then we also have sub-Article 1E, which talks about every child has a right to parental care, meaning that anything outside the parents, then it will be termed as alternative. But the Constitution of Kenya and the Children's Act of 2022, they are putting a lot of emphasis on how we can be able to bring up children in the family environment. Then we also have the 2014 Alternative Family Care Guidelines and Care Reform Strategy that is also helping us to be able to implement care reform. It largely deals with facilitation and provisions of alternative families for children in need of care. Most of these children, the reason as to why they are being separated, it's because in one way or the other, they are in need of protection and care. And so it is upon each and every one of us to ensure that whenever we come across any child, we need to understand, or we need also to find out which kind of need is actually this child having, and under which circumstances is maybe making this particular child to move away from home. So alternative care option, it is sometimes short-lived or long-lived, and therefore we need to know that it is informal and also formal. We have the United Nations principles that are guiding us, especially in terms of care reform. One of the principles that we have in place is the principle of necessity, and two, the principle of suitability. Necessity, we are asking ourselves, when we want to move this particular child from the family or wherever place, that particular place of origin, is it necessary for that particular child to move? Is there any other way that probably can be done to be able to prevent this child from being separated from the family of origin or from the biological family? There are things that sometimes may happen to a child and they can still be handled within that particular environment or locality without necessarily interfering with the child being moved away from the family. As we look at that, the necessity principle is actually helping us to be able to manage or maintain the first pillar of care reform, which is preventing family separation. And we are also looking at, as I pointed out earlier, especially in the legal instruments that are helping us in this process, we are looking at what is this best interest of the child in our scenario that we are talking about. Suitability. We also ask ourselves, is it suitable in this case? Wherever we want to take this particular child, is it suitable in terms of availing the basic needs of the child. And the kind of services probably that we want to offer to this particular child, are they suitable? Because sometimes you can maybe move a child from the place of origin to a new place, thinking that you are helping this particular child, while in the real sense, you are doing more harm to this particular child. So we need to be guided under these two principles, the principle of necessity and the principle of suitability. Where you don't understand, just lift up your hand and then I'll be able to spot you so that we can listen to region. We also have kafala. Kafala, in this case, it is more or less related to kinship, but for our Muslim brothers, this is a situation whereby they bring children to a place or a family so that in terms of giving support, the Muslim brothers or community are able to offer themselves and give support when children are actually put under a family, so that they are able to continue with their daily activities, but the support is coming from the entire community within. Children are not given out. Many times we are informed that Muslim community do not advocate for adoption. I don't know if I'm right, Madam Khadija. Yeah, so that is for kafala. It is not so much different from what the Catholics faith-based are doing, because you realize that most of the work that has been mentioned here, it's actually the effort of the faithfuls in the church. So we have also foster care. Foster care, as it is indicated, this is where a child is placed under a responsible adult so that they may be able to assume responsibility. But in this case, the child is not related to this particular family by blood. Okay? They are not related at all by blood. But the child is put under that particular family, and the family must be willing and ready to assume parental responsibility. That means that they'll be able to provide all the basic needs that are required by that particular child. But normally it is done by court. It's done by court, where it is the court that commits that particular child to that willing family so that they can be able to support it, or to support that particular child, sorry. And in this case, it's actually a short-lived period. It goes up to a maximum of 1 year. But thereafter, you can be able to renew the committal orders through the court. And of course, the person who does the committal, I said, is the court, but the application has to be done by the children's officer, who is within that area of jurisdiction. So renewal can be done twice. We have the first committal, which takes 1 year or 12 months. Then thereafter, if maybe the family feels that the needs of this particular child have not been met yet, they can still go back to court to request for an extension for another year. Then thereafter again, after a period now of 2 years, if the family still feels that the needs have not yet fully met again, they can go now for the final renewal, which is now up to a maximum of 3 years. So foster care, it's actually short-lived. It takes up to a maximum of 3 years. But normally, it is done, it is first committal is for 1 year, then renewal for another year, then the last 1 year. We also have what we call adoption. Adoption, as most of us understand, it is a permanent process, and it is normally done especially when all these others have failed, or if in the event that maybe a child is found to have been orphaned, then there is no any other relative or person within that particular community that is willing to either practice the various options that we've talked about. So it is actually like the last decision that one has to make so that a child is given out for adoption. It is permanent. It is permanent, and for that case, probably if I'll be able to respond, allow me to respond briefly on some question that was raised, that a child, twins were born in a hospital, then the mother ran away. Then through the children's office, the children were committed to the CCI. Then thereafter, according to the explanation from the bishop, he said he learned that these children had some kinsmen. And thereafter, there was that kind of fear on how to commit these children to adoption. I want to say that the adoption process will not be easy in that scenario because, one, the relatives or the kinsmen have been identified. Then two, there are chances of the biological mother coming back to claim the children. It is not easy, especially for a mother, just to abandon the children. I've witnessed a scenario, especially when I was in Migori County, where a mother gave birth to children and then she abandoned them. There were two. We took these children, we placed them under a CCI in Kisumu, and after a period of 6 months, the mother resurfaced and she wanted back the children. So it is not easy just to commit those children under adoption, especially if you know very well that probably whoever gave birth to those children is just from within. So through tracing and also a creation of maybe awareness within the community and through the network that would have been created in between, you'd be able to trace the mother of that particular, those twins. Are we together? So in this case, when you look at which color is this? Is it green? This one from sky blue. Okay, now this is what we are talking about, family-based care, okay? For our community-based care, in this case, it is supported child-headed household. We had one of the care leavers here was talking about having been given the responsibility to take charge of the siblings. So in that scenario, we can call that particular care leaver as a child, but of course now he's above 18, he's no longer a child, but now he's a responsible adult. But if the care leaver was below 18, we could have actually termed it as child-headed household. Then we also have supported independent living. Supported independent living now is what the care leavers actually were talking about, that they are able to be prepared and helped or supported just to live on their own, and try to make both ends meet in that particular scenario. But I want also to say that even as we advocate for support and all that, once you are born, my experience has been that from the kind of life that we are exposed, especially when we are growing up, sometimes it's very, very harsh. Very, very harsh. But thank God that our parents are able to accommodate us during that particular time. So we are exposed to very tough lives, and we learn to adopt. So I probably would suggest in the near future that if our institutions also, as they try to come up with the strategies of actually helping our caregivers to be able to adjust to and fit well in our society, also try to expose them to some tough lives. Not always, but once in a while, okay? Once in a while. Like sleeping without food, it will not kill you. It will not kill you. Yeah, just once in a while. Yes, I'm very sincere about this because personally I've slept hungry like 1 week without any solid food. Not because I was fasting, because I didn't even know how to fast. But here I am. I look healthy. Is that okay? I look very healthy. You can never know that I went through such kind of lives. Anyway, it was just by the way, but we are also in the process of learning. So the two, supported child-headed household and supported independent living, is what we are actually referring to community-based care. And then we have places of safety and temporary shelter, then specialized therapeutic facilities, and then charitable children institutions. These are institutional-based or residential care. It refers to orphanages or children homes or other group living arrangements for children in which care is provided by paid adults who will not be regarded as traditional carers in wider society. So this is what we are talking about. That if family-based care option is not working, then let us try to look at community-based care. If it is not working, as a last result, of course, and that is why my colleague yesterday when he was responding to the issue of not closing down the CCIs, it is that these CCIs are still going to be helpful even for us. Because in situations where you find an abandoned child, a very young child, whom you cannot, as a children officer, I'm not allowed to go with that particular child back at home. And sometimes, many times, we've been taking our children to the hospital facility. And you go there, sometimes you find that the nurses will tell you, you know, this place is actually full. We do not have any space for them. So what next? We actually opt, because it is maybe late in the evening, we shall actually communicate with the manager in the CCIs just to give us some space where that child will be placed for a short while. And a short while, sometimes it can actually be more than a month. So in that case, we can't actually close down the CCIs. Sasa tuko pamoja. Are we together? Are we together in that? Yeah, but we are actually trying to work our best to ensure that these children do not spend a lot of time in the institution. I'm bringing in this scenario so that you don't sleep. And I'm saying that nobody is sleeping. You can clap for yourselves. Thank you. Thank you so much. Promoting and strengthening alternative care options in the wake of care reform. We want to promote and we want also to strengthen. Where are we putting a lot of emphasis in terms of strengthening? We want to strengthen our families. And I was so happy during the presentations. I saw a group here trying to reach out to the community and empowering them economically, trying to bring in new ideas of God-keeping so that they can be able to have at least a source of income, which is very good. And this is quite important for us because it is bringing about sustainability. There are things that the government is actually trying to do in terms of promotion and strengthening of alternative care options. One of them has been establishment of the National Care Reform Oversight and Coordination Division. This is actually based at the county level, just to ensure that it is working closely with the community at that particular level to help in the process of reintegration of these particular children, and also ensuring that actually gatekeeping measures are put in place to help these children not to be separated from the family of origin or from the community. Then 2, we have development of alternative family care, CCI in this case, it's the charitable children institutions, CWP, adoption, guardianship, and foster regulations. Now, we have in this place Mr. We call him Babu Stanley, who is actually stationed at the National Council for Children's Services. This is a body that has been charged with coming up with policies and regulations, of course, in conjunction with the stakeholders and partners. And they have been doing a very good job, and quite a number of regulations have been put in place so that they are aligning themselves to the new Children's Act that we have in place. Then we have development of the National Alternative Family Care Standard Operating Procedures to guide the placement of children. For us to be able to ensure that the children that are being reintegrated back to the community, if you are seeing your neighbor behaving in a manner likely to suggest that he's giving a very serious prayer, kindly mushtue, alafu mwambie, we are together. Is that okay? Hallelujah. So these guidelines are the ones that we look at to ensure that in the process of reintegrating this particular child back to the community, we are not doing any harm to this particular child. We follow step by step. In this, you realize that it's quite a lot of assessment that is done at the home where the child comes from. You also look at the needs of this particular child and so on. So we also have development of foster care training manual. Foster care, this is what many times we find ourselves doing, but sometimes we've been doing it not because we understand the process, but there is need to do it. So for us to be able, as government, we've come up with the training manual that is able to help so that the TOTs, trainers of trainers, are able to help the community and also other key stakeholders in this process to understand when we talk about foster care, what are we talking about? Are we looking at some parts and maybe trying to avoid others, but we want to do it in a more comprehensive manner so that we don't bring harm to the child. Then we have training of children officers and other workforce on alternative family care, foster care placement, etc. In this case, I want to say that even this process, as we are moving with it, not all children officers in our directorate have been trained, but we have started the process of actually reaching out to every single children officer so that they can be able to understand the process and embrace it. It is actually something that requires a lot of resources, but with time we believe that we are going to make it. Another thing is piloting of foster care in 6 counties. We have Kisumu, where I think I mentioned this thing yesterday. We had the pilot program taking place in 6 counties. Kisumu was one of them, Nyamira, Kiambu, Murang'a, Mombasa, Kilifi, and all that. Why? So that we could be able to see, is it workable? Is this thing that we are talking about working or it is not working? But we found out that it is working, and that is why it is being rolled out to all counties in the country. Training of foster parents on foster care. This is the process that is on the way. Many people have been trained, quite a number of people have been trained. But training is one thing. And now the parents, the potential foster care parents, for them now to come out willingly and ready and say that now we are able to take up the task, it's also another thing. Sometimes you can train maybe like 50, then you realize that at the end of the day, those who are ready to actually go ahead with the foster care program maybe are 20. Why? Because that's the time now you are telling them the real thing. If it is maybe like taking up a task of maybe supporting a child who is living, a child with disability, now they come to realize that it is not easy. They come to realize that maybe some of their time will be taken away. Some of them maybe they need 24/7 kind of watch or service. So some will be able to pull out. But the process, the training has been ongoing. There are those ones that have been trained and they have picked up children, and the process is good. So enhancing national reporting mechanisms to capture evidence-based data. This is something that is very key, that without data we cannot be able to say that we are making progress. You look at the number of children that probably were there in the institution before you started the process. Then after some time, you also realize that there are a number of children that have already been reintegrated back to the community. And then when you go to the system, for us, we do use CPMS, Child Protection Information Management System. So it helps you to be able to understand that in this CCI, this particular child maybe has reached this particular stage, and this one has been reintegrated, and these ones are still left. So there you are able even to plan for those that are still in the CCI. I also want to say that even as you do that, not every CCI will be moving at the same rate. There are those ones that will probably, in terms of creating awareness, just to sensitize the children who are living there and the staff, will be maybe at a higher level. Others will maybe still be talking about how do we go about it, maybe trying to convince the sponsors or the donors. So it takes various levels depending on the CCI's way of commitment to the process. Then we also have situation analysis that was done, and this was in 14 counties, just to be able to establish how many children do we have that are actually in need of care and protection. And I want to say, maybe as I come to the conclusion, that not all children who are in the CCIs are in need of care and protection. Some are actually in conflict with the law. So, like the statutory institutions that we have in the country, remand homes, where children are kept for a short while their matter are being processed in court. So those are also children that are at the same time, in as much as they are conflicting with the law, they are also in need of care and protection, because they still remain to be a children, even if they have committed that offense. So we also have National Care System Assessment and Funding Stream Analysis. Yes, sir. Well, it's a mix. Some, of course, now, like in the first one, there were 6. Then here, why 6 is because, one, it depended with the resources that were available at that time. And then 2, it also depended with the partners who had shown interest. And you know, in this case, I want to say that there are partners who are working in certain counties. So they may want to join in the process of care reform, but not moving out of their counties. Because remember, they have a commitment with their sponsors or donors. So it is in that particular area that they'll be able to do the piloting. Of course, I want to say this, that government, everything about care reform or every human being belongs to the government. So the partners are coming in just to support or to supplement the government's work. So there's no child that we can say that this child belongs to this partner or this NGO. The child of this country belongs to the government. And every single process or every single effort that we put in place, it is actually just trying to supplement the work of the government. Okay.
Make a suggestion with all due respect, Father Kevo. We let David finish his presentation. We get to hear briefly from other countries, then we open it up for Q&A. So, thanks.
Good. Thank you for coming to my rescue. Yeah, Father was really coming like Calandro. I don't know whether it was Calandro or whatever. Yeah, so a National Care System Assessment and Funding Stream Analysis. This one was an assessment that was being carried out to be able to help the CCI to understand this process and also help them be able to talk to their their donors to see if the amount of money that they have been receiving, where this money is coming from, how much is it, and as government also to look at it, whether the government can be able to manage even in the absence of the donors. Next point, stakeholder engagement for synergy. Of course, you have to bring together all the stakeholders to be able to help us understand and be able to embrace the idea. And by embracing, then it means that they'll be able to help us fast track the process. Because now you'll be joined together and you'll be working as a team in terms of maybe bringing together various skills, various resources, and as a team, now you can be able to achieve a lot. Thank you so much. I want to, before I come back to Father, yes, you had something. Okay, fine. Father, now you can come.
Before we invite Father, Mr. David Magogo, can we just appreciate you? Yes. So, Father Kevo sio hiyo. Ile mzuri. I hear there's another one called Milpolo. Piach! That one, Milpolo is the gun, eh? Ama nini? That one. So you can see he's a thunder and lightning. So let's really appreciate our colleague from government for, standing here is not easy. Sindio, the people who have stood here, it's not an easy task. So let's appreciate our colleague from the Directorate of Children's Services with government colleagues with the nikisema Milpolo, piach, buna chapa. Na umeme itoke na moto. Milpolo, piach. Milpolo, piach. Milpolo, piach. Thank you. So really appreciating the work, and this is the essence of this presentation. But before we go, I would really also want to call upon our colleagues from government to also share some light. But before that, I would love to check if we have anyone in this house, in this room, from Malawi. Anyone from Malawi? Thank you, Father. Is it a father or? Please forgive me if I call you with a different title or salutation. Anyone from Zambia? Zambia, thank you. Which is the other country? Tanzania? Sudan? South Sudan. Yeah, so is it okay, not putting you on the spot, but if you have Tanzania, thank you. Is it Zambia? Uganda? Ama menda hiyo session ingine. Any other country? Zambia? Ethiopia? Oh, sister. Ethiopia is also represented. So anyone who is really willing, and briefly just to share, if you have an idea of what is happening in terms of both at the level of the Catholic and how the government is really promoting, so that we can also hear. It doesn't mean that Kenya is doing everything and whatever we are doing here is good. But I believe even other countries are doing an amazing work, and it would be nice to hear some of those examples of what the government is doing, how is it working with the church in terms of promoting care. If not, even at the level of the church, do we have any beautiful experiences you would love to share? I start with Malawi. Anything, Father, you want to share? Anything unique? Ilikuwa wapi? Zambia. Nothing?
Actually, it is one of the reasons why I decided to stay here, because in Zambia we do not have a deliberate policy where the government is doing something to ensure that we take back the children to their families. What I know the church is doing, we are doing both actually. We have continued with the institutions, and at the same time, we have got some congregations of sisters who have started the process of taking the children back to families. But for the government, that's why I wanted to learn how we are doing it here in Kenya.
Thank you so much for choosing the session, and kudos to the government of Kenya. Ethiopia?
Just like Father said, in Ethiopia, the government is not so much involved in what is and care and reforms, but the church is doing something, not to the extent that it is being done here in Kenya, but we have some CCIs, and of course the sisters try as much as possible to integrate the children back to the community at their level, the level of their institutions, but not so much. Thank you.
Thank you so much, sister. Really amazing feedback, and that confirms why this room is almost half filled. There's a lot of learning and a lot of interest. I think in future, in such a forum, we may want to consider getting representative from government to also come and hear from their fellow. You know, the government have a language that they speak to one another. So this is something probably we can consider in future. South Sudan, right?
Thank you. Okay, thank you for this chance. I really don't have very, resource information, but a little I know that the church have about good number of homes that care for the children, both orphans and children who others ran away from their homes, and the government as well, they have orphanage that they care for these children. After a certain age, these children are taken back to their either family or relatives that can care. For the government, if there is no any relative, a child will say, for me, I don't have anybody. For meantime, I wait until I get somebody, then I take. The same with the sisters and other ladies who have orphanages. At a certain moment, they also take these children back home. And this is the little, very little, I know of what is happening in South Sudan. Otherwise, the church and the government are caring. Thank you.
So I'm also from South Sudan, but in different part. I just want also to share what is happening in the part where I am. Yeah, the government in western part of South Sudan, what they do, they help in psychosocial support, and mostly they don't do this care reform, and only those in the church or the sisters are the one doing that. But there is no specific place whereby all the children are gathered and they have their parents, but only those whom their parents have died. And mostly they help them spiritually, and so that they may grow with all the characteristics, or with the good nature to be good people in the future. But the challenges comes now with the street children who are moving on their way. For the government people, they will say the child is not allowed to be moving from 6 to this time. If this one happens, they will punish the parents. And when it happens, they arrest the parents and put them inside without explaining or without helping them to help the children. That's what is happening in Western part. Thank you.
Amazing, amazing lessons learning. I think, Kenya, you may want to speak to the street-connected children issues and see how that can be, shared. But I think something very unique coming up, which is worth, probably once we move out of here, our colleagues would consider having some engagement with government and really being advocates of standardizing care for children within the countries where we are coming from. Father, do you have anything?
Thank you very much. As regards the alternative care options, I think you Kenyans are far away. In Tanzania, we have got the ministry which is dealing with the women, children, and those people living with the disabilities. But the greatest attention is given by the FBOs, faith-based organizations. The government does not involve itself much in those alternative care options. That's all.
Let's clap for our colleagues who have just shared. I think it's pretty very obvious, very evident that something is happening. We are at different level, and we can actually learn from each country in terms of how things are in the way we want to change the way we care for children. And government, I think for us here in Kenya, the leadership, the oversight, guidance from government has really helped us really push the agenda of care reform in country. And I think the people who are represented here from Kenya can actually offer some, side session conversation on how, from where I sit as a non-state actors, I took time to understand the language for me to communicate well with the government. You can either be chased or they become your friends. Us as changing the way we care in Kenya, we can call and knock at their doors at any time, and including other partners who are represented here. We have become friends. We have become colleagues. It has really worked for us, both national government and even the county government. Is there any other country we have missed? Going once? Twice? Thrice. Now I'm coming back home now. There are two things that I would request to share, and I am putting people on the spot. One, I would want Mr. Jacob Konyango, our regional coordinator from the western region of this country. He comes from the implementation on the ground, just to give us a brief of what is happening when it comes to promoting alternative family care. How are we doing in terms of reducing influx of children into institution? Our colleague David Magogo said abandoned children are taken to. Is that the situation? What is the role of foster care in this? And then once you are done, I'll request Madam Mordecai. There's a very special thing that is happening at the directorate that she represents, which I do not want to preempt, for her to share something, and then I'll get it back to the colleagues from Kenya to speak briefly about the street connected, or even you, Mr. Konyango. Thank you.
Yeah, thank you, moderator. Kevo, it's time to own up. It's true, Konyango is sleeping, but the advantage Konyango can wake up to actualize the dream. From our neighbor from Tanzania, you would appreciate that Konyango remembers to wake up to actualize the dream. I'm aware Harry is a big library in this, but there are two issues that I want to address and put straight, because in my own interpretation, they were addressed, but they were more convenient, but I want to put them accurate. One, on the transition Kevo, I want you open the Children Act, the transition guidelines or provisions, the 7th schedule. If you check Children Act 2022, that is page 260. The transitional guideline there states that CCIs, upon coming into effect of the children law, shall operate for 10 years. That is provisional 1. Provisional 2 states that the cabinet secretary, in consultation with the National Council for Children's Services, shall come up with regulations. Last week, I was part of the making of CCI regulations to operationalize the children law. And this is what we came up with, that by 27th of July 2032, the CCI is no more operations. Check the transitional guidelines, 7th schedule, page 2060 of the Children Act. You will get the answer. Let's not play games. Let's not play games. 2, I want to address inconsistencies that emanated as regard to the practice of foster care. I want to put things straight. Number 1, foster care as it is practiced in Kenya and explained in the children law, you are giving a person a child. This person is not related to this child. He is not a relative. He is not a guardian. But it is on temporary basis. The temporary basis here refers to 1 year. And on application to the secretary. That is, you apply to Konyango if you want to foster a child in Kenya. Under delegated powers, I'm acting on behalf of the secretary. Kevo, I want you to get this clear. You first apply to the secretary. Then you are given a child on temporary basis. This child is not yours. You are not related to this child, but on temporary basis for a period of 12 months. That is 1 year. But the Children Act, on the basis of the principle of the best interest of the child, gives a leeway or a provision for extension, but not more than 3 years in aggregate. Meaning, if you are given a child under foster care, you cannot stay with that child beyond 3 years. I want that to come clear. But because still on the application of best interest of the child, and when I'm talking about best interest, the word best simply means what is appropriate that may be long-term or short-term. But interest refers to the core pillars, UN pillars. That is, number 1 pillar, survival. The second one, development. The third one, protection. Last, participation. Those are important pillars in this application. You can't stay with this child beyond 3 years. But because of what I've talked about, best interest, this law gives further extension, but now states on leave of court. Now not Konyango or secretary. On leave of court. You will have to explain to court the circumstances under which you are seeking those extension. But if court is satisfied, then you will be given that extension. I think that makes clarity of what actually constitutes the practice of foster care. Another important area under foster care, you cannot be given more than 4 children within one person or within a specific household. That should also be clear. Unless these children are related by blood or they are relatives. Let that be very, very clear. An individual cannot have more than 4 children at a given time under foster care. And foster care is temporary. It is administrative. Meaning, the subject, it does not give the subject the privileges, the power to become a legal member of the family. Unless you wanted me to talk about something else. Let me also explain something on care reform. Because somebody had asked whether the implementation of care reform in this country is rounded. And somebody is also doubting the participation, the involvement of government in the making of care reform implementation. That is where I'm coming from. I want to state this. Government is the force, the leading agency in matters of care reform. And when you look at the 3 pillars of care reform, pillar 1 is purely prevention. Prevention. And it is calling for the government and the development partners, both state and non-state actors, to invest healthcare, education, livelihood support, social protection, rehabilitative services, and all that. It is purely preventive services. It's calling for preventive or promotive services. But pillar 2 is talking about responsive, curative. A problem has so occurred. You are looking for medicine. You are looking for cure. Then the 3rd pillar is also responsive. But these 3 pillars, to make them holistic, to make them work, they are under what we call cross-cutting issues, the enablers. And when you look at the enablers, government is taking lead. Number 1 enabler is legislative framework. The government is now coming with regulations to have the children law in operations. The government has done the strategy, the national strategy, to guide the implementation steps, and many, many other legislative framework. You cannot do anything. This is not a world of the jungle without reference to law and policy. The government is taking lead on that. 2, another enabler is the workforce. Kevo, do you doubt my training? Because number 1, you cannot talk about something without knowledge, the expertise. And that is why we have gathered here for purposes of learning. And the government, since coming of age of care reform, the government came up with a program in Kenya School of Government. That is the Child Protection Management course. And within that course, there is Module 6, that is talking about emerging issues. And the number one emerging issue is care reform. So far, the government has trained 419 officers, both state and non-state. I'm one of them. Thank you.
That was a crash course on care reform and what the government has done to promote care reform. And I think the room was like, wow, wow. So, Madam Mordecai, let me just get back to the audience and probably get like 2 questions and then we can come to you. Father Kevo. Yes.
I cannot doubt the knowledge of Mr. Konyan. But in their presentation, senior there and senior here, I was waiting to listen to the answers of what our people here presented with all that knowledge. When they go, somebody presented the case of, I come from the CCI and I found my land has been grabbed. What is the answer to the government? That somebody came, I go for job and I'm taken to the 14th floor. What is the answer of the government on these cases?
Rightly put it. So because we are running out of time and we did not want to give the answers in the absence of the other team members, we are agreeing that we will convene, get a few recap of some of the proceedings from the other sessions, get to hear from our colleagues from Muranga, and then tomorrow morning when we are very fresh, we will have our government colleagues seated in front of this conference and ask those tough questions and request for those responses to those tough questions that were asked by our young members of the society. So our government colleagues have noted, and you come prepared tomorrow because we are ready for you. Yes, we will look for him. Yeah? Yeah, but... But thank you so much, Father Kevo, for noting that. Let me get maybe 2 questions, and then we will ask Madam Mordecai. So, Father, you also? So I have my sister here.
Thank you for holding me.
Thank you for this opportunity. So my question goes to our able Mr. Konyango. In case of, for example, a CCI is not registered and you want to take those children for foster care and they don't have any documentation, I was asking, can a committal order to the foster parents grant the children probably a documentation which will help in school, because it's actually practically, it's what we are experiencing on the ground. Thank you.
So we'll take the 3 questions, then get the answers.
Mine goes to David. I think you talked about the child protection information management systems. I'm always interested in this technology. And now that we've been talking about our champions who are championing the care reform, I'm guessing that these management systems are also able to give us modalities of reporting abuse. So how can this be available to our champions in our various areas so that it becomes a tool for use?
Thank you so much.
Yeah, mine is not a question but a comment. From the sharing that our care leavers did this morning, as well as to what the presenter alluded to about transiting the care leavers from the CCI to the community, they mentioned something that they are not able to do what other children in the other community are doing, like doing the house chores, doing the basic things that any other person living in the community is able to do. I think it is important to encourage the managers of CCIs to encourage the children in the CCI and make them participate in activities that will make them fit well in the society without any problem. Thank you.
As Mr. Konyango takes the first question, sister, that's very important, and I will ask you for the moderators of tomorrow's session to give you this mic to say what you've just said, so that the other people who are not here, they can benefit. But I mean, we all agree that life skills is very, very critical. If we have children in institutions whose life is 8, 12, 4, 6, nobody washes clothes for them, the beds are being made for them, and this child is taken out without preparation, I mean, they will be confused. They'll be traumatized. So I think preparation and life skills is very critical. Sister, thank you so much for bringing that up. So I'll ask Mr. Konyango question 1, and then David.
Yeah, I think you can also share with Harry, but I'll just talk about the value of care orders and court committal warrants, because it came from our Koki story. I want to say this. According to the children law, all children getting to CCIs must be accompanied with a court committal warrant. But in the event that a child is committed to a CCI under orders of authorized officer, an authorized officer defined in children law as a children's officer, a police officer, a medical practitioner, a probation officer, a labor officer, a teacher, name it. In the event that a child is committed under the instructions of an authorized officer, the law says that child should stay in the CCI for 7 days, upon which you seek a committal warrant. And I want to tell you, if you listened to Koki's story, that girl suffered because somebody neglected that. Somebody neglected that. And that is very important. And sometimes people take this for granted. And our government is funny. I've witnessed situations, they wait until there is crisis. Sometimes you think Konyango is sleeping. Fine, we sleep, because it is natural. But we wake up when there is a crisis. Like those fires that you hear in the institution. I also one time witnessed a child that was electrocuted in a CCI. That is the day you will see the big government cars visiting you. So the first precaution as a CCI manager, please ensure that all the children that you have in your institution, they have court committal warrants. It is out of those court committal warrants that a child will benefit to get those legal documentations like birth certificate up to ID. It is also important because children also die. Yeah, they are human. They die. When a child dies, CCI, you will not turn CCI to graveside. You simply get back to court, make fresh applications that the local limits, that is the county government, to inter the body are simple. Are simple. That is when you will get to understand the value of court committal warrant. So it is important, and I would encourage you, ensure you go for it. And it is a simple application.
Thank you so much, Mr. Konyango. Harry, as you answer, can you please tell us what happens to children in institutions that are not registered? I think that was also one of the concerns that she had. Thank you, Mr. Konyango, for that comprehensive response.
Well, number one, I don't know at what point the courts started issuing committal orders to institutions which are not registered. Legally, they should not. However, due to so many complications, we know those things to happen.
And number two, I know some of us is according and we're doing the best we can for the children, and we cannot rule out that the best interest of the child, blah, 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 blah. But learning an institution of children without a registration is too risky, very risky. Because you're not, number one, the institution itself and the management themselves, they are not protected by the law. If tomorrow something happens, like Senior Konyango is saying, if something happens to a child in such institutions, which is not registered, you're not covered, it's illegal. You know, when now, for example, if kama mtu anataka kuleta siasa, if somebody just want to victimize you, they can bring so many legal complications. As actually the first thing the court even want, why are you not registered? So it is very critical. I was learning the institutional thing. I have the files, and Catholic Church is doing very well, and so many files I have even on my table when I'm evaluating and looking at these applications. I think the bishops here, you will need to help me here. Because one of the requirements of registration of a CCI or renewal of registration is the title deed or a lease. I would never, by law, I will never register a CCI, not now, you're not registering. I will never renew certificate of any CCIs if I do not have the copy of title deed of the CCI written on the name of that CCI or a lease. And that has been quite a big challenge when I'm doing, not just the Catholic Church. Most churches, they have kind of an issue when it comes to, this is our institution, this is our CCI, and it is run by the same systems. We belong here. Why would you ask me to license my own institutions? That kind of things. But the law says so. However, I would, because, like we keep on saying, as we protect the children, you need to protect yourself very much. Because if you do not protect yourself against the law, you know, we know, all of us, if we lay down the laws and say, we don't even ask for, because you're doing a good job, actually. You're protecting these children who are in need of care protection, and you're doing the best you can, and especially the church. We know some other CCIs, they are doing some other businesses. We know that. Nasitete Catholic, but at least in the Catholic, I have never had issues of child trafficking, we have never had child molestations, especially in our researches, but some others, we have a manager making all the girls age 12 and above their wives. You can imagine those situations. And once we have gone to a situation and we come and ask a manager, and then one girl, 12 years, she's pregnant of a manager. And then we ask the wife, are you aware of this? And you know what the wife said? It was so disturbing, and I almost said, if I were allowed to slap him, I would. The lady said, si ni maneno tu ya wanaume. And I was saying, these institutions really, but anyway, those are, in fact, when we are doing care reform, we are not doing because of those bad ones. We are doing because of the good people, for example, who are doing good work, and we also need to be protected. So I don't know how you would operate. I know they do, but if we follow the law to the letter, no children officer should commit a child to an institution that is not registered. No court should. In fact, and I challenge that court order. Why, Judge, Your Honor, would you give a committal to a child who could be committed to an institution that is not protected by the law? Because that is what we say. When we license you, we are protecting you and protecting those students. So I think that would be something that needs to be taken on.
Yeah, thank you so much, Harry. I know Father has a follow-on question, and then we bring Magogo to answer. As I give this mic to Father, I'm just wondering, what happens to children who are already in those unregistered CCI?
So mine is about responding to the question he's just asked about the issue of lands and titles. Because I'm in charge of the titles of the lands in the Diocese of Mombasa.
Oh, you should see me.
And we know that in matters lands, even our parishes are not legal entities. Only the dioceses are legal entities. So when we are running a CCI in my parish, I cannot have a portion of land that has a title that reads the CCI. All our lands read the Archdiocese of Mombasa registered trustees. So when I'm giving you a title, I'll not be giving you a title that reads the name of the CCI, but I'll give you a copy of the title of the Catholic Archdiocese of Mombasa Registered Trustees.
It is not a must for a title deed. I think the law gives two options. You see the archdiocese who holds the?
Yeah, it's the legal entity as far as lands are
the one that
concerned.
holds the title, right?
Yes, yes.
The trustees should give you now a lease for 5 years. We have leased this portion. Hata kama ni ya Kakwota, because they are the one who owns the land where the institution is. So because we know for sure not everybody can be able to acquire the title deed, actually we even accept, what do you call them from the Kaju? Zinaitwa aje zile za Kaju? Not title deed.
The licenses.
No. Allotment, yes.
Okay,
allotment, yes. So if you cannot get a title deed, you can get a lease. And in Kenya, we don't know why anybody can, it is your things, you just lease them for 5 years because that's the security of the children. So if you cannot get the title deed, get a lease. The trustees can give you a lease, say, whatever this institution is, we lease these boys or girls or this institution for 5 years. That's all what is required by the law. A title deed, if it can, what's okay. If it cannot, a lease.
You see, because I'm seeing a situation where now the father who gives birth to a child, when it comes to management, now has to lease his land to his child for a period of 5 years. So what happens now? If my lease is for 5 years, you register my CCI, it has only legality in 5 years. What happens at the expiry of 5 years? Yes? Yes.
So once you see the lease, the time will be coming now, the 6th year for renewal, you'll need them to renew.
The lease again.
It is just maybe a stamp of the license of the lease or for continuation of another 5 years. Do you know why? Do you know the reason why the lease is required? You know the reason why the law requires this lease? For security reasons. One day you wake up and today you say, I want to close this institution. Government, kujeni mchukue watoto wetu. We need time to prepare, get the people who are able to help us, what do you call them, Child Welfare Society, who are interested with now transiting to watoto wetu to peleka somewhere. We need time to be able to transit all 100 children in that institutions. So you cannot just wake up. That's why actually we need the licenses. You cannot just wake up one morning and say, I'm closing this institution or I'm transferring. By the way, and that's another thing that people should know. It is illegal to transfer children from one institution which is licensed to another one in a different county or sub-county just in the name because they all belong to the church, right? You may say because this child is registered in Nairobi, I want to transit these 5 children to the licensed one. You cannot do that. That is illegal because you need to come to us and say we are transiting these children and you justify why we are transiting these children to a different institution. And neither can you use one license for more than 2 institutions. Because this is for this diocese, so we have license for this and whatever, this one, so it can learn CCI 1, CCI 2, CCI 3. Every CCI is considered by the law as autonomous. That's why they have to be given all this.
Father, are you convinced? Or we need to have further consultation? Yeah, I think it's, yeah, because I'm even, and I think, yeah, because it's a bit...
Yeah, actually, I know this issue came up in our last training in Mombasa, and we need to do a bit of consultation with you as a government because the ownership of the CCI also belongs to the same church.
Who is the land
the diocese?
Who is the landowner?
Exactly, who is the landowner? So the issue is a bit, needs a bit of consultation, so we cannot make a decision here. Thank you.
Thank you, Elizabeth. And that's the reason I asked Father whether he's convinced, because I felt we needed to take this conversation. Surrender it, eh? I have completely surrendered that conversation, but I think, Elizabeth, let's take note of that. Where are you going?
No, when I go back to the office.
Okay.
Who owns the land? Is this trustees or what in the Catholic system? Who owns?
The case of Mombasa, all the lands are owned by the Archdiocese of Mombasa registered trustees. of Mombasa registered trustees, where we have 5 registered trustees.
Now, this registered trustee of Mombasa, the whole of Lad, can issue leases to any of their, even if they have 10, 20, they can be able to issue those there.
I think there is something like this, Mr. Harry. So can we, what was the word, Kevo? Surrender. We surrender it now, Father, if that's okay. But I think it's a conversation that really needs to be discussed further because of the modalities of operation, which may, so I know some decisions would come in. So one on CPMIS, then Mordecai.
Yeah, thank you. I just wanted to respond on the issue of CPMS. CPMS is very important, very, very important for every single institution that is handling children, because it is through which the government is able to get at least to know the number of children that are hosted in that particular institution, and also to track the processes that are taking place in terms of care reform. And also, it's actually a reporting tool in the event of maybe you want to identify the kind of abuses that are taking place in the institution or in any other given area of jurisdiction. So it is mandatory, and that is why the government has taken upon itself to ensure that every institution that hosts children have been capacity built in terms of how to enter data into the system. And therefore, if maybe there is any institution that has not been trained, its staff has not been trained on matters CPIMS, then it's very important that you liaise with the area children officer who is in that area so that they can be able to liaise with the team at the headquarters just to be able to facilitate in the training process. So it's very important, and already the government is actually in the process of training. It has already trained some, though I'm not happy to report that the reports that we are getting or the kind of data that we are getting coming from the institutions are not so good. We don't know the problem, but we are there every single minute when you call about maybe an issue that has arose through the system, you'll be responded to there and then. We've been able to move around, especially in Kilifi, just to identify some of the work that is going on in the system, and we realized that quite a number of those staff that were trained, some have left, and the institution did not even bother to inform the children office, and therefore they get stuck and there's no reporting that is taking place. So kindly, maybe it's just a call to every individual person who is here, in the event that maybe you own an institution and your staff have not been trained in data management in the system, kindly reach out to the children's office in your area of jurisdiction so that plans can be done for the training to take place. Thank you.
Thank you, Mr. Magogo. Elizabeth, I know, Father, you are aware we trained institution on CPMIS, the 14, and of the 14, 6 or is it 5 that they are already in the live system? 13 are now live from the 14. So I think Father has an interest in CPMIS. The next monitoring visit that will happen, Elizabeth, let's make sure Father Anna to join so that we learn. We next learning forum, Father becomes the champion and tells us how that is working on the ground. I know our colleagues from the other room are coming in. I'm not so sure whether the other group is in, but Mordecai, you can speak as I consult so that we move to the next session.
Afternoon. My name is Mary Mordecai. I come from the Directorate of Social Development in a unit known as Family Promotion and Social Welfare Division. I would want to say that the government is committed to ensuring that families are protected, because when you look at the Constitution, at Article 45 of the Constitution, It says that the family is the natural and the fundamental unit of society and the basis of social order. And it goes ahead and say, therefore, it shall be protected by the government. And when you also look at Article 53 of the Constitution, whereby each child has a constitutional right to parental care and responsibility, and equal responsibility from both mother and father, whether they are married or not. It is on this basis that, as a directorate, we've come up with a national family promotion and protection policy. The policy was approved back last year by the cabinet, and it is on action. It's out of this policy that we have been able to come up with a program known as the National Positive Parenting Program. The program that we have been working with KCCB, we've been able to train at least the numbers you were given of supervisors and facilitators that now will be rolling out this program to these parents and caregivers. The program has some essential documents that if I had an opportunity, I would have shared with you how the program is being implemented from the national level to the county level up to the community level. But we are working with partners because it's an evidence-based parenting program. Our aim is just to equip parents with skills, to change their knowledge, attitude, and perception about this parenting thing. So we are working with the DCS because we have to work together to be able to ensure that we strengthen families. Because when you look at the care reform strategies, we come in key pillar number 1 on prevention of separations of families at risk of separation. So we come in there to give parents more knowledge and skills on how to stay together, how to work together as parents to be able to realize and ensure that children grow into a full potential. So the program is in the scaling. We are working with different partners to roll out in different counties. Thank you.
So much, Mordecai. I think if you all agree with me, the government of Kenya, we need to appreciate them. Ama nadanganya? Hawafanyi? Wanafanya, si ndio? Waswahili wanakuambia mgala muue na haki yake mpe, si ndio? Hata kama ni kubaya, kuna some element of good things happening. So let's give them 3, then Kevo, and then we are expecting the other group to join in. We get a report out. We close the day. I know we are exhausted. So there are sessions that we will move to tomorrow. And the interesting one is the one with the government in front here for, that interactive session. So, ebu tuwapatie moja, mbili. Haya. Moja inaendaje? 1, alafu 2, 1, 2, alafu 3, 1, 2, 3. Sawa. Haya, moja. 1, 2. 1, 2, 3. Haya, Kevo.
Yes, just on what Mordecai has just shared, and what His Grace yesterday shared, on making sure that the families stay together. And the same government is the one increasing the prices for marriage certificate. To an extent nowadays, my Christians are telling me, instead of going to wed in the church, better I buy more cows and I take to my in-laws. Because what tried sometimes bring unity and not movement much in the marriages is that certificate. And if it's not there, mtusaidi hata kama mnaongelea mambo ya parenting and them being together, tuwafunge ndoa. At least wakipokea mwili wa Yesu, they are somehow protected by the blood and body of Jesus. Then, like when they walk out, ama namna gani? Mordecai, umenisikia?
Yeah, those are some of the takeaways that we want them to go and tell. Don't make our lives difficult, Bwana.
No, they are making our life difficult. If a priest cannot wed the Christians because the 10,000 who will go and buy a certificate of 10,000, the sacramental life is going down. Yeah. And that is affecting family life.
True.
And then parenting, separation is just as normal as eating ugali and samaki.
Yeah. Yeah. I think that was a very strong message, if you agree with me, very strong message. We really need to think. Some of these issues that are here may be beyond Harry, beyond Mordecai, and we are the government. We also need to find forums where we are actually speaking and giving some of this feedback. And I think if we bring in, on the same table, the church hierarchy with the government and even other religious, I think they're usually listened to by the government. So I think that's one of the takeaway, Edith and team. How can we make sure the top leadership from the church, from any other religion, really seeks audience where some of these pertinent issues, matters family, matters children, are actually aired out, and we just need to come up with consensus on how to make this work. So I believe, Teresia, the team is now back. So we are not running so well in terms of time. So what we want to do, remember we had 3 groups. We had one that was here on seminar. We had another group that was looking at the role of the church and community engagement in promoting alternative family care option. Then the other team was looking at some of the lessons learned, challenges, and opportunities that exist around promoting alternative family care. And we had moderators. So what we are requesting for the moderators of the session, we are requesting you to be very brief. Please give us top 3 takeaways from those conversations that happened, so that we can all benefit on what happened. And when you present, tell us what was the team talking about. Give us 3 top priority takeaways from there, and then we'll then take this back to close for the day. Can I start with the main hall? Is the reporter for the main hall ready? The main hall, the main conference. Were you the one? Benson, Mr. You are giving. Okay. Sister Clara, were you the one doing the opportunities? Are you ready? You're ready. So top 3 takeaways. I know a lot of conversation happened, very interesting. But give us top 3 of each. If you can give us as many within 5 minutes, that's still fine. But top 3. So tell us what the team was discussing on, and what are some of from the many, group them into themes. Thank you.
Okay, I will try to do that. Our topic was on opportunities, challenges, and lessons learned in promoting family-based care options. So there was a lot of discussion for sure. So let me just give you the top 3 of each. On the opportunities, we discussed that the promotion or reinforcement of family life in the African culture and context, this is an opportunity that is being brought by this way of doing. And then the legal framework is also supporting the foster care or adoption, is supporting the process, which we are happy about. Then there's sensitization of communities that the best place for a child is the family. There's a lot of media around, people are able to access media, so dissemination of this information and sensitization is possible, and communities seem to be warming up to the idea or to the process. Right, then I go to challenges. On the challenges, we discovered that there are cultural beliefs which prohibit adoption if maybe people are not from the same clan, same family. When they lack that biological bond, there are still those cultural beliefs. Then there's also stigma in accepting some of the children, particularly children with disabilities. There's still resistance there, or people are not forthcoming. And then also some, depending on where they are coming from, prospective families are not willing. And then there's also low self-esteem, which takes children a long time to adapt to their new situation. Right, I jump on to the lessons that have been learned. The multi-sectoral approach has made it easier for the process, because so many other people are involved in the process, or also to guide the process. Then the provision of case management tools, which has made the process also easy for those who are already championing the process. So the fact that there are tools in place. And then there's a strong network with other organizations that is also helping in the process that we are trying to put in place.
Thank you so much, the group and sister, for presenting the team. Let's give them a beautiful one. Tupashe, pasha, 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 moja ya nguvu. Thank you. Do you know what my takeaway is from that session? That I am a proud African. We have forgotten how we were brought up. I'm not young. In terms of, for those of us who are my age, we were children of the community. Sindio? Ilikuwa mamangu akinichapa. I mean, jirani akinichapa. And then my mom asikie kuwa jirani alinichapa. Hiyo nyumba inalalika. So let's be proud Africans. I know it's difficult because I am a modern parent. Mwenye jirani akichapa mtoto wangu, ninasimama hapo hivyo. It has spoiled. But I think, Father, I mean, Bishop, you attest to this, that the way we were brought up, we were children of the community, we were given the culture we knew. I think we just need to go back to that for us to be able to raise a society that is responsive. Thank you so much for that, to that group. Group hiyo ingine? Kuna makofi ingine hapa, Sister Advina, nataka Delvin, tupatiane hiyo group tena. Thank you.
So, good evening. I'm presenting on behalf of the group that was here in the main hall. And some of the key takeaways that we have come up with is that the church in different countries, we've heard from Zambia, Ethiopia, South Sudan, and Tanzania, the church is promoting the alternative family care, though we've seen that this is happening at different levels, but something is happening. Then there's work that is also happening from the different governments of those countries, still promoting family-based care. Then there's one key takeaway that we've just concluded the meeting with, or the session, that there needs to be a meeting of the Catholic Church leadership with the government leaders as well, to ensure that family matters are looked so that we can make them seamless. And finally, we've seen that for the CCIs, the institutions, there's need for committal orders for the children and the institutions to be registered, because this way everyone is protected by the law. Thank you.
Thank you so much, Benson and the team. Let's give them a beautiful one. Asante. So my notable takeaway is coordination between the church, the other religion, the other faith, on a table where people will candidly have a candid conversation and agree on how to continue promoting family-based care and community-based care to ensure that children live in safe and nurturing environment. Once again, thanks to that team. I go to the other team. Yes, Teresa.
Hello. Sorry. Yes, in our group, we were looking at the role of the Catholic Church in alternative family care. And what we started with was by understanding what is alternative family care and the different options. And then we looked now at the role, and we realized that the Catholic Church really has a very rich platform in terms of being able to, to embrace alternative family care. Because one, it is possible to create awareness, to do advocacy to the congregants and beyond. It is possible to strengthen families, because the most important thing is really having strengthened families. We had one very good question from the Vicar General from Zambia who asked us. We are saying we bring children to the families, but how are these families that we already have, where everything is being done by the house helps? So they may even be worse because the children are not learning, the skills. So we need to strengthen the families. We also take advantage of the structures that we have so that we are able to identify families or, Christians who can be able to do, for example, like foster care or any other form of alternative family care. And more so to be able to enhance, the spiritual part of the Christians, build their capacity, and even probably come up with social support groups that can be able to support alternative family care within the church, and more so being able to really leverage on that structure. The Catholic Church is in a way that it really operates in a way that everybody fits, right from the diocese to the small Christian community. When you look at the youths, we have what we call PMC, the Pontifical Missionary Children. We have those in secondary school, they have their class, the young adults and all that. So it is possible for the church to embrace child participation using those platforms, using the ecclesiastical groups that we have in the church. And it becomes very rich for everybody to understand alternative family care. But more importantly, I want to mention what really is going to guide these. We'll be guided as a church by the teachings, because when we embrace alternative family care, then we are living to the faith. But what is most critical, as per the Catholic social teachings, is that the family is the first natural society that is irreplaceable. Therefore, alternative family care will ensure that families remain together and they're strengthened together. Then there's the advantage of giving that holistic approach, information of an integral human, human development, using the family, centered approach as opposed to the child. All this can happen when the child is outside an institution and is embracing the alternative family care. Then it also creates a platform for evangelization by the church itself. And of course, we also mentioned the fears and the challenges that the church has. And one of them, like I mentioned, is that we're having so many, dysfunctional families, the legal processes when it comes to, for example, in adoption. Something also came up, and I like that the group has also mentioned it, the need for the Catholic Church and the government now to sit together, get it to an MOU, because we wouldn't want to have a situation where, sort of this has been offloaded to the church, and the church may not be able to do, provide most of these services around alternative family care. So, yes, so there is the issue of engagement, the issue of resource mobilization, actually mapping what is within the church, outside the church, and then be able to see how all that is used to create awareness, build capacity, and embrace alternative family care. Thank you.
Thank you so much to that group, the role of the church and community engagement, the fears around promoting family-based care. Tuangushie moja. Thank you so much. If you can see me, clap once. If you can see me, clap twice. If you can hear me, clap thrice. Thank you very much. That's an appreciation that I have chosen to give myself. But let me just summarize that group. I think what is coming out very strongly, I have worked with the archdioceses and dioceses when I joined CRS in 2006. Please don't calculate my age. using that one. You may not get it correctly. But one thing I appreciated is that the church has structures from up here to down there. And it is very easy to implement activities. I appreciated that as a Muslim. I felt part of the community, and I really learned a lot. When I started, I didn't know how to, I didn't know the difference between an archdiocese and a diocese, a bishop and an archbishop. But I learned, and that is why I have been in CRS so many years, which I do not want to mention. And I appreciate the things that I have learned. And honestly, the Catholic social teachings, not different from my religion. Not very different, and really it brings us to that reality that we all believe in that one Lord. So those were my parting shot, and just to say a huge thank you to each and every one of you for participating this afternoon. It's been an amazing, it feels like ingekuwa day one, so I am hoping that tomorrow we will come back energized. We have 2 sessions, the experience sharing, which will be done in the morning. We will also have our colleagues from the government to engage with. And there are questions that were asked in the main conference, and we said we do not want the government to respond in the absence of the other team. So those questions that were asked by our young colleagues here, we will appreciate responses tomorrow and engage with the government tomorrow so that we can actually get some of this information cleared here and plan on how we can get them cleared after the session. As we do that, allow me to welcome my brother, George, to wind up today's session. And I request that you also appreciate me for the good work.
You do not have to request that I appreciate you, because honestly, it feels nice being relieved of the task. You know, it's not very easy standing the whole day. So getting my sister to do exactly what I'm supposed to be doing, honestly, I don't take it for granted. Thank you so much, Adija, for moderating the afternoon session. I kept popping in and out of your group discussions, and I could tell they are very rich discussions. To the rest of the delegates, sincere one appreciation for the day. Like she has said, it's been a long day. We started early in the morning. This is the latest I think we've done. Yesterday we finished a bit early. This is quite late, and you've been very patient and very understanding. I want to most sincerely thank you for that, and apologize for this kind of a delay. A few announcements. One, there was a request that we get a healthy corner during our meals, and that was granted. If you are still not aware that we have a healthy corner where you can take food that is less spiced, that is not very oily, kindly check. There's a healthy corner where you can get a healthy serving of your food. And not to mean that the rest of the food is not healthy. I don't know how else to put that. Then we have we have 3 registration forms. One by CRS, one by Amecea Secretariat, and one by the hotel. Those 3 lists, it's important you kindly agree to sign the 3 of them, because one, for us to be able to settle the bills for our expenses here, we have to compare the 3 lists and make sure that they match. The number of people in all those lists have to match. Again, it's important for us to be accountable to the persons who have entrusted resources to us. Kindly help us by signing the 3 forms. The last announcement, Pauline had made a request that if you'd want to change currencies, which we actually encourage all of you to change from your dollars. You leave them with us. Don't take them back where you came from. It is, you know, your countries don't need those dollars. But here in Kenya, we need those dollars. If you would want to change your currencies to get a feel of our shillings, kindly talk to Pauline. I'm sure by now you all know Pauline. She's outside here. Just talk to her. She'll help you to change the dollars to a local currency, and that will help you to purchase 1 or 2 items. If we still keep saying that we are committed to ensuring your comfort, if you have any issues, and I'm glad that a number of us have been assisted, I still am aware of one or two people who are requesting a change. We are looking into that, and I'm glad that the majority of us who had requested a change here and there, that has been effected. If that has not been possible, it's not because we've ignored your request. It's because the facility had a shortfall in terms of its ability to accommodate everybody here. But your requests have been actively in our minds, and we are trying to do our best to ensure that you are as comfortable as possible. Having said that, allow me to ask my Lord Bishop to dismiss us with a blessing, and we await tomorrow. I do not want to talk about tomorrow because as that Adija has done exactly that. We will have a morning session that picks from where we stopped. Then we'll have Father Fred leading us in a discussion on safeguarding, and then hopefully we will conclude our conference by around 12. We do not anticipate to get into the afternoon. Even though we have carried forward work from today, we still are committed to maintain the timelines that we had agreed. Thank you so much. Mbarikiwe sana. Mass tomorrow still is at 7. Mass is at 7 right here, and you are most welcome. Thank you so much, my Lord Bishop. You.
In the name of the Father, and of the Son, and of the Holy Spirit, glory be to the Father, and to the Son, and to the Holy Spirit. Beginning is now, and ever shall be, world without end. Amen. The Lord be with you. Almighty God bless you, the Father, the Son, and the Holy Spirit. Have a nice evening.
Thank you. And kindly take a cup of tea, take a cup of your favorite coffee, take a cup of chocolate. It's served for us.